Good morning, everyone. It's Representative Dent. So we're still waiting for folks to join the meeting, and we'll get started here as we get a few more members of the committee on board. Thank you. Thank you for your patience. Folks, we're having a couple little technical difficulties here too this morning, so bear with us, and we'll be beginning here in just a couple minutes. Well, while we're waiting, I'll share a little story here this morning that happened to me today. I was a little late coming in the office this morning, but just a little past midnight last night, just down from my house with the road I live on, a county road, another road tees into it. And an individual ran the stop sign, crashed into my pasture, and took out a power pole, which made quite a bit of noise, which woke me up. And as I looked out my window, there was the most fantastic light show I'd ever seen out in my front yard, with the problem being it was in my trees, and it was also connected with fire. So calling the fire department and going out and shoveling dirt on the fire, and we get the fire out. The deputies arrive, and they're looking at the damage, and they the individual who had crashed through the fence and knocked everything over had left the scene. And unfortunately for him, he left his license plate off his car behind. So the deputies went off to find him, and the PUD showed up to fix the damage, and they were able to get us restored with power about 6:50 this morning. And as I left my house, they were still out there trying to fix the fiber that was destroyed as well. So anyway, kind of a pretty eventful day that started really early this morning. So anyway, that's my trivia this morning, my trivia story for the morning.
Representative Dent, this is Krista. We're still working on trying to get the video capability for all hosts and panelists. If you want to, we could start with just audio and cover the opening remarks as well as roll call, and I can read through the minutes because we'll be able to present that on the screen. And hopefully we'll get it figured out by our first agenda item beginning, if that works for you.
Yes, it does. Thank you. So, and I'm sure that Nicholas will have it figured out here in a few minutes. So good morning, everyone. It's good to almost see everybody this morning, and we will here momentarily, I'm sure. But always look forward to our oversight board meetings because there's always good stuff that we learn and a chance to visit with folks that have the passion around the children that those of us on this board do. So, and I want you to know that I appreciate each and every one of you for being here today, and your passion for our children is not lost on me. I'll guarantee you that. So thank you again for what you do and for being willing to engage in a sometimes very sensitive issues that we're faced with. But it means we just had a meeting, and other than that, I don't really have much to say. Krista, would you call the roll?
Yes. Board members, if you're present, please unmute yourself and let me know you are here. Katie Byron. I actually see Katie in the waiting room or the attendance, but Katie, Annie Blackledge. Justice Bobby Bridge. Ben DeHaan.
Present.
Co-chair Representative Tom Dent. Sydney Forrester.
Yeah.
Good morning, everyone.
Good morning, Sydney. Lonnie Greniger.
Good morning, everyone. I am here.
Ruth Kagi.
Good morning, I'm here.
Annie Lee.
I'm here.
Dr. Diane Levy.
Present.
Charles Loeffler. Lois Martin. Sharonda Selivanoff. Representative Tana Sen.
Here.
Senator Judy Warnick. Senator Claire Wilson. And Assistant Attorney General Kristen Lamson, are you on the call as well?
Present.
Thank you. We have 9 board members present, and that is quorum.
Thank you, Krista. Appreciate that. And would you review the meeting minutes from our meeting on July 7th?
Yes, and it looks like at least I have my video capability back. So board members, if you can try your video, and if not, Nicholas is in the process of working on that.
Yeah, mine still doesn't work, Krista.
Okay. At least he's
I have to one by one make everyone coach.
thing. So it'll be one by one, but it's coming.
Thank you, Nicholas. Appreciate your
Yeah.
hard work on that.
Thank you, Nicholas.
So I will pull up the draft meeting minutes the board members received, and I will review them quickly for the public. The last board meeting the Oversight Board held was Thursday. It's actually July 7th. So I will fix that date. It was 2 weeks ago. The meeting came to order at 10:05. The first agenda item was DCYF presented on their prevention strategies across the continuum of care. Presenters included Assistant Secretary of Prevention and Client Services, Steve Grilly, as well as Director of the Office of Innovation, Alignment, and Accountability, Dr. Vicky Ybarra. DCYF presented a presentation on the agency's prevention strategy across the continuum of care. The presentation included a review of how the agency manages prevention as a top priority, its vision and leadership, current progress, next steps, and how prevention progress is being measured and the agency is being held accountable to its commitments and legislative mandates. In the review of the current progress and work moving forward, DCYF's Assistant Secretary of Prevention and Client Services briefed the board on a range of existing, developing, and expanding pilots and programs, including strengthening families locally, home visiting, child welfare and early learning navigators, pregnant substance use disorder pilot, plan of safe care, the family reconciliation services redesign, and motivational interviewing. DCYF also previewed how prevention is featured as one of the agency's top priorities for the 2023 legislative session. Challenges for expanding prevention services remain and include funding, dependency on cross-agency work to fulfill the agency's charge, and overall access to services, in particular services in rural communities, and ensuring provided services are culturally responsive. Dr. Vicky Ybarra reviewed intake and placement data utilized by DCYF to target prevention strategies in communities indicating the highest need. Additionally, Dr. Ybarra briefed the board on outcome, balancing, and leading indicators used by the agency to measure prevention efforts. This included a discussion on the agency's goal to reduce the number of children and youth in out-of-home care by half. Follow-up items requested by the DCYF from board members included detailed plans on how prevention programs pilots will be implemented and expanded, how the agency was monitoring potentially negative outcomes for children and families as the number of youth in out-of-home care continues to decrease each year, referral services available for other primary providers working with children and families who wish to be mandatory supporters in addition to be mandatory reporters, data trends on the number and or rate of children who re-enter care during their 30 and or 60-day trial return home period, the length of time a family is eligible for childcare after the closure of a child welfare case, and any preliminary data that may be available that supports the success of the Child Welfare and Early Learning Navigator program. There was 3 participants that provided public comment during the meeting, and those are summarized in the minutes. The board also received 2 written public comments for the July 7th meeting that were distributed to board members on July 6th for their review. Those are also summarized in the minutes. The final agenda item, the board had an opportunity to discuss and debrief the prevention discussion provided by DCYF. In this discussion, there was identified areas of significance, interest, and concern for potential future follow-up from the board, which include continued monitoring of prevention work in progress, funding options for prevention strategies, particularly culturally responsive services, assessing the utilization and effectiveness of the family assessment response as a prevention strategy, DCYF's efforts, strategy, and detailed action plans for addressing and transforming the historically distrustful relationship communities and families have had with the child welfare system, prevention strategies in the juvenile justice and juvenile rehabilitation space, particularly regarding diversion, determining the board's authority to request investigations as mentioned in public comment, invite the Director of Early Learning to speak to the board on how early learning plays a part in the agency's prevention strategies across the continuum of care, updates on the development and procurement of the child welfare workload study that was funded in the 2022 legislative session, and engaging in courts who add increasing workload demands on existing caseworkers' workloads. The board also received a briefing on updates to the Open Public Meetings Act with the passage of House Bill 1329 in the 2022 legislative session, as well as a review of new meeting protocols and policies. And the meeting was adjourned at 1:37 p.m.
Thank you, Krista. Do any of the members have any additions, changes, corrections to the minutes that were just read? Everybody's shaking their head, so that's a good thing. Thank you. We'll let the minutes stand as presented. Thank you. So today, I think this is going to be really an interesting presentation today. The board has the opportunity to hear about DCYF's progress and changes in juvenile rehabilitation. And I have to say, that's just something that I'm not really up on. So I'm really looking forward to hearing about this. The last time the board heard from the juvenile rehabilitation was in the summer of 2020, a time when the division was working to address the challenges introduced by the COVID-19 pandemic. Actually, we still are working on some of those challenges today, but we're making headway for sure. But since that meeting, DCYF has appointed a new assistant secretary to juvenile rehabilitation, as well as worked on the implementation of a new major legislation, including JR to 25 and enhanced community transition services. Today, the board will hear about those changes and how these changes are impacting the division's performance in its legislatively mandated outcomes. So it's my pleasure this morning to introduce Assistant Secretary Felice Upton. Take it away, Felice. Thank you for being here. We appreciate you.
Good morning. Thank you for having me. And I think Nicholas will be manning the slides, right? But yeah, we were thrilled to be invited and be able to talk about the progress in juvenile rehabilitation. I can tell you around COVID, we've been really successful in our mitigation strategies. We have not had, we've had 0 deaths and no hospitalizations because of COVID, and have 2 mitigation nurses who are serving statewide now to keep our rates low and keep the young people and our staff healthy. So we're pretty proud of the work that we've done in that space, and we'll continue to grow that work. So yeah, so here's the, yeah, I was appointed last July. And so I know that we sent along our annual report. We're trying to be really transparent in the work that we do, and we'll continue to update people about our challenges and stretches and strengths and the ways that we are trying to show up for young people. And if there are questions after reading the annual report, I am glad to answer those as well, because it goes a little bit deeper into what we'll talk about today. So next slide, please. So we wanted to share kind of our vision last year and moving forward. And some of that was based on our staffing survey that was done in 2018, the Heiser report, that talked about going deeper and being more thoughtful about the work that we were doing, making sure that the people doing the work had the skills, knowledge, ability, and time to do that work well, so that we were best serving every young person. So we've spent a lot of time working on our foundation. Our vision, of course, is that all young people in our care are able to realize their full potential and realize success in the way that they determine it. We're really spending a lot of time listening to the young people that we serve and not imposing our own belief system on what we think success is or what that should look like, and making sure that we're properly resourced. And that doesn't necessarily mean more. It means moving around the people that we've had and having them be more intentional about the work, as well as in some pockets, additional resource and investment that's been made in JR and getting that put in place, which I'll talk about today. Next slide, please. So as was noted in the introduction by Representative Dent, we are kind of moving into, in the last couple of years, our population has aged. We're now serving the JR to 25 population. You will see in a couple of slides, our length of stay is going up because we are serving some of the kids that have adult sentences. So we're serving people for longer and trying to be really deliberate about that. And that's a little bit counterintuitive. It's also a population that historically juvenile rehabilitation didn't serve. Our population was historically 15, 16. Now, many of the young people that we're serving are 18, so we're being really careful about language. We're also being really careful about the services that we put in place and making sure that we're responsive to their needs. Next slide, please. So you can see our length of stay going up over the last couple of years, admissions going down, and overall population is down. And I will talk more about what length of stay means, how we're rolling that out, and our investment to doing this better. We are starting engagement in a technical assistance program through Georgetown University to make sure that time spent with us at each level is thoughtful and the least harmful possible. Kind of our philosophy is based in trauma-informed care in all spaces. So making sure that we are not doing harm to the young people that we serve, and that we have environments in which they can flourish, but that kids are in the right place at the right time. Sorry, I try not to call them kids. 18-year-olds really don't like being called kids. So we're working on the language shift as well. But you can see our average daily population here, as well as certainly admissions are going down. Next slide, please. So our client characteristics, this is the race and ethnicity that is between 2018 and 2021, the makeup of our population. Within all of these categories, populations are overrepresented. We see our American Indian, Alaska Native population overrepresented in comparison to the population of this age that are not in carceral environments. And the Hispanic population has grown in carceral environments. And so we're kind of digging into what does that mean? Why is this occurring? What counties is it occurring in? And how do we best thought partner with people? Next slide, please. Sorry that I'm flying through these. There are some that are really heavy in content. So again, our population by sentence type, what we're seeing is a higher level of acuity in the young people that we serve. So while the population number is going down, we're also seeing a more, a population that has multiple needs that we really need to focus on. They are more acutely, they have behavioral health needs that we hadn't seen historically, and they are older. They're also with us for longer periods of time. As you can see, the through line there is, you know, a few years ago, people were with us on average for 310 days, now 370 days. And that population is being impacted by the longer JR to 25 sentences. So people who will be with us until their 25th birthday and then potentially go to the Department of Corrections. Next slide, please. So our demographics, and these are just a few that we'll end up talking about a lot in kind of the, historically it's been called reentry, and I like to call it transition from juvenile systems because many of our young people have not, they're not reentering. They're getting to show up for the first time in whatever way that they want to. But we know that all of these factors will heavily influence their success or return to us. So child welfare involvement lifetime for our population sits at about 79%. Making sure that young people that we serve, if they've had housing instability, will have stable housing when they release, and really looking forward into that process for if they release with housing, which we are releasing everybody with housing, why are they becoming unattached to housing and at what point, and really working with our partners across systems to make sure we're leaning into why that's occurring. How many kids, young people are working, and because again, the population is getting older, many more are eligible to work, and what kind of jobs are we preparing them for? Are we doing career readiness? And you'll see that we've grown our young adult programming in the last couple of years pretty significantly so that they have as many options as they'd like. graduation levels. Haley Lau is here today. She'll be talking about what we're doing in the K-12 space and the expansion of opportunity to really learn in ways that kids attach well to. And then we'll be talking a little bit about behavioral health needs and what we're finding through some of the work that we're doing in behavioral health, including a national grant in opiate use disorder. Next slide, please. So we're really, in many ways, changing the way we see this work. We want to be innovative. We want to lean in. We are in every way challenging ourselves to be trauma informed. And that means that we're showing up differently, that we know that adults, especially during the pandemic, have maybe not been as well as we want to say we are, and that kids really feel that. And so in all of our environments, strengthening the people who care for the young people so that they can best show up. We have been doing co-learning in yoga for our staff and young people together to really recognize triggers, motivation, how to have more coping skills in difficult situations. And the pandemic's been a really fun opportunity. I can't believe I just said that. It's been a challenging opportunity for us to really lean in. And I think rather than saying we cannot innovate right now, we've really leaned in and said, we have to innovate. We have to do this now. We suddenly can do video visiting, and we have young people who are doing telepsych in ways that they allegedly were unable to previously, and more access in telehealth, and really helping families to be able to see their kids more if they are not located in the same part of the state. So really listening to the young people and families that we serve, as well as our employees who really care deeply about outcomes for young people and are helping us to see best, like, how are we showing up? How do we create environments that stimulate growth and development? Next slide, please. So I like to do things in threes. It helps my mind. Hopefully it helps others. But really, we want to focus on three things, do them really well each year, and then hopefully check them off a list. None of these will ever be done, but they are commitments that we've made at a high level. So the first is to data-driven decisions. There's lots of data sets that influence juvenile justice and juvenile legal systems across the nation. We are engaging in as many of those thoughtfully as possible. One is our Office of Innovation and Alignment often gives us feedback on things that we could do better. And that's really driven by the data. And we've taken them up on it and made some changes and some investments to make sure that we're doing our work well. And Dr. Andrew Fox is with us to talk about some of that today. We're also now engaged in, we've always been engaged in performance-based standards, which is a set of standards that we are evaluated to twice a year in October and April. And it asks things like, do young people feel safe in this environment? Do they believe that this is a fair environment? We've now committed to doing that in our community facilities, and in summer, we will commit to doing that in our parole operations. And the reason for that is to continue to improve and have external eyes on our work to hold us accountable and keep us honest, but also looks across systems to say, who's being most innovative in this space? So that's been a fun process to join. If we are able to implement parole standards this summer, we will be one of only a few states that's engaged in all three levels of performance-based standards. And then our activity with the Council of Juvenile Justice Administrators, which represents juvenile justice administrators from all states, has really gone up. We're engaged in multiple forums on how to do things like room confinement, drive those numbers down. We are on 3 committees for use of force and the legality of that. We are heavily engaged in emergency operations planning through CJJA and the Office of Juvenile Justice and Delinquency Programs. So just trying to get the best lessons that we can from our peers that are doing work in this space and implementing it. As far as staff efficacy and resilience, we have leaned into trauma stewardship. I talked about the Yoga Behind Bars partnership a minute ago. It's been really powerful. We've invited in formerly incarcerated adults who are teaching both our staff and young people how to recognize what's happening in their body when hormone surges with fight or flight occur, so that they can have thoughtful kind of mindfulness practices. If they are triggered, as you know, many of the young people that we serve have trauma histories that are pretty complex and complex needs. And so it's important to be able to serve them in a million different ways and offer lots of coping strategies. We've also ensured that in our K-12 system, we leaned in with the Holistic Life Foundation to make sure that we're doing mindfulness resets for young people in classrooms if they're overstimulated or cannot engage at that moment with their classroom. We want to make sure that we're not suspending or expelling kids when they're in a carceral environment, that we are offering them an opportunity to reset and working with our youth engagement teams at both Green Hill and Echo Glen to get back to the classroom as quickly as possible. So they engage in a pretty cool practice that came out of Baltimore, where they have driven down the amount of expulsions and suspensions in some schools there using the Holistic Life Foundation curricula. We also are addressing staff impacts of turnover. We've had pretty high turnover for about the last 6 years. The impacts on young people are pretty, if we don't address this, if we don't lean in and lean into the professionalism and training of our staff, the young people don't get the service that they need. And so we've really put a lot of effort into that system, making sure that people are well trained when they start, so that for their own good, but also we are serving some of the most vulnerable young people in the state. And it's really important to me that people are ready for what they may encounter, and to really show up as their whole selves. So when we have high turnover, we know it increases youth's dynamic risk factors. They don't get their needs met as much, decreases our ability to provide therapeutic interactions because you cannot get as skilled if you don't have long-term commitment to this work. Just getting oriented to JR and the way that we go about our work, as well as dialectic behavioral therapy, which we do throughout the continuum, takes some time to get to fidelity. And then reduction in staff engagement with the family and community, which can impact their reentry. So we're doing, and not for this meeting, but in a future meeting, I'd love to talk about some of the staff initiatives that we've done to make sure that staff are well engaged, well trained, and ready to really serve. In our therapeutic environments, a commitment to trauma-informed care. We've worked closely with Laura Vandernoot-Lipsky, who's done some care for both our young people and our employees, Yoga Behind Bars. We've also worked with some dispute resolution centers on restorative justice practices, and are working with people with lived experience in peer support. And then spending some time moving away from a historic risk model that talks about kind of static risk and why you came to us in the first place, and moving into dynamic risk, or the things that my employees can help change as they assess and continue to assess as young people get their needs met through our system. Next slide, please. So, next slide, please. So our staff efficacy and therapeutic interventions, the way that we've leaned into this, I wanted to make sure that we're talking about like things we've done and where we're headed next. So as I said earlier, we are seeing a lot of complex trauma. What we didn't have a year ago was a new employee academy. So we have scaled a new employee academy. It's 3 weeks before you can work with young people. We talk about all kinds of things. The legality of your job, the expectations of your job. People are getting heavy crisis de-escalation and crisis management training so that they can really know how to work with kids, as well as milieu management for prevention strategy. It's been really good. We also moved to a new crisis management system or physical system. What we had previously needed to be updated, and we are moving into the world of de-escalation and like really getting well trained on de-escalation and what young people might be feeling if they're exhibiting symptoms of, you know, violence to self or others, what people should do and how they should engage with young people. And our intent there is we don't want to be going hands-on with young people. That is not the way that we want to show up. And kind of historic carceral system training around compliance is something that we're moving away from. So that curriculum is a week long. People become really skilled in how to de-escalate people and put themselves in the shoes of a person that's in crisis, with the recognition that often a person who's in crisis isn't there. So how do you engage with them, and what is the impact? Our environments are a little more complex than others because you also have other kids in the environment who are being triggered by the young person who is in crisis. So how do we help them through that process? We also hired dedicated full-time expert trainers who we are paying. What we had used historically were practitioner trainers, which means they're not necessarily well trained in how to train people. It's that just because you're good at it doesn't mean you know how to teach others to be good at it piece. So we're really spending a lot of time making sure that the content that's being delivered to new employees is good, that people are doing the work in the way that we expect, and that we have a culture of accountability and positivity and innovation. So we've hired 5 full-time expert trainers thus far, and this is within current resources, and we are onboarding 5 more statewide that will travel, that will make sure that people are doing their work to fidelity and that they continually are being trained up. We have integrated trauma-informed care into our new employee training, into our counseling model. We just made a pretty major shift in the way that we do counseling because we onboarded some experts in substance use disorder through our behavioral health decision package. So we've been able to really properly resource some of the work that we do so that we can do expert level work at it. We also have brought on both staff peer support to make sure that we're responding to staff when there is a crisis, as well as youth peer support. And we're working with multiple organizations on that peer support. Okay, next slide. I'm trying to be mindful of time too. We have a lot of slides. Am I okay so far? And Andrew, I'm going to ask you to present the slide, please. Andrew.
Yes. So on room confinement and isolation, in line with some of the stuff that Felice was referencing about trauma-informed care, we've really learned that the use of room confinement isolation can be harmful to youth, especially those with extensive trauma histories. And so there's been a lot of work over the past number of years to reduce room confinement isolation. And that work was fast forward or expedited with the passing of Bill 2277 that puts parameters around how room confinement isolation could be used in juvenile facilities. Along with that work, a group of us in DCYF applied to a program through Georgetown that looked at certain reforms at ending isolation in youth facilities. And so a group of us went out to DC for a week to learn from other locations and national experts on alternative tools and how to reduce room confinement. We've been working for the past year with the team at Greenhill to do just that. And we put together, the project was a review team. So every incident of room confinement isolation is then reviewed to compare it to policy, but also to identify areas for improvement. It's really about, I mean, we're never going to fully get rid of room confinement isolation, but one of the main goals is to shorten the length of time. So when a youth does get put in their room or in isolation, making sure they come out as quickly as possible and joining other youth. And so we've seen incredible reductions in the amount of time that youth are actually put in, where years ago you would see lots of incidents that would be over 12 or 24 hours. That is exceptionally rare now. It's more around an hour or even shorter that youth are being put in their room to be allowed to calm down and to work with staff before they come back out and join the rest. So the other goal of that project is to identify youth that are experiencing lots of events of room confinement isolation, to identify treatments and other interventions that might be able to be used to prevent that from continuing to happen. We are working, so part of Bill 2277, the requirement is that next year in 23, data on room confinement isolation will become public, both from JR and detention facilities in the county. So we are working on preparing that data, and we look forward to the time where it will be public next year for everyone to see the rates of room confinement isolation in the facilities.
Thank you. Next slide, please. So we wanted to give an update on community transition services, which is a new option in lieu of confinement, which was from the 2021 session, which is a less restrictive alternative. It'll allow young people to serve a portion of their residential sentence in the community. Work we've done so far to kind of lay the groundwork for that included 2 co-design processes with stakeholder groups. We worked with tribal partners, and we also worked with a stakeholder group, a separate stakeholder group. We did a comprehensive needs assessment about kind of what do people who have been formerly incarcerated and have recidivated say they need. We used our current kind of assessment model, so the risk or the needs areas, to inform that so that we would be able to best do wraparound care for young people. We had a lot of conversations with the group about, which included people from all across the state, about safe and supportive housing, what they really needed as far as outsider identity and stigma, and things like, how do you acknowledge that your family might be unhealthy for you? Some of the complexity of transition into community, some of the concern about being identified as formerly incarcerated, some of the concern about not knowing what to do if you have $100 and like, what do you buy first if that's all you have right now? What do you do next? What do you do if you don't know how to navigate the internet or have digital literacy? We also are working on continuing to scale our independent living skills training and listening to young people about the needs that they have during that process. We have submitted the 1186 report is now available as of Monday, which also has some information about perceived service deserts, where we believe that young people may have difficulties in accessing the types of services that they need. There are, of course, counties that have tons of resources, but we continue to evaluate whether the young people will actually be able to meet up with services. And this is a space where we've really leaned in, and my team has presented to managed care a couple of times and is working closely with our partners where there's been some historic siloing so that we have the most user-friendly experience. It's also really helped us to listen to our certified peer counselors who have actually experienced the systems and the impact of the systems where they've fallen through the cracks in services. And making sure that we are talking to partners across the state that are culturally responsive and accessible, as well as continuing to scale peer mentorship. The power of our peer mentorship initiatives has really been felt throughout our system. Somebody reminded me this morning that we started a program called Made Men at Green Hill in the middle of the pandemic. Green Hill School is seeing the lowest levels of violence and room confinement and the lowest levels of staffing that they've seen in years. And those three things don't typically go together. But the empowerment of young people and the staff who are encouraging them to be empowered and really own who they are as leaders has really made a difference. So I'm excited to be able to share both today and in future sessions. And I'd love for them to be able to share that experience more than me getting to share what they've done. But young people who are currently and formerly incarcerated in JR are kind of taking leadership roles and making sure that our young people are served well. Our job is to kick the door open and make sure that they have the access that they need, and transforming what it means to gatekeep. That we really need to open doors to people who know how to do this work well. We continue to work on the needs assessment, and Andrew will talk about that a little bit. But we continue to work on every milieu, like every place that you might be placed in the continuum of JR needs to be the most therapeutic possible. Regardless of where you are, you should always be forward moving. You should always be moving closer to minimum or community. And we don't want to see people go backwards. And historically, if you've moved too quickly, sometimes there is a backslide. So how do we strengthen those steps so that kids can be successful at in every step? Next slide, please. The additional supports, so community assisted reentry is in place. This allows for people, and this is backdated without a parole obligation, to get critical community-based services. So we do have CAR employees who are reaching out to people who have been out of our system for a little while to offer them services. There's been a mixed reaction so far. I think there is historic distrust, and so a lot of times when we're calling young people, they're like, what's the catch? And I think the only way to move past that is to continue to show up. And we have some pretty dedicated, incredible people in those positions who will help access community based services for young people who have previously or are currently in our care, even if they don't have a parole obligation. We hope to get those started always before a young person's release. So as we're working on the reentry, we do reentry treatment meetings. They would be on that committee that's involved. And folks like Haley in education have also started joining those reentry team meetings as full wraparound so that we're doing warm handoffs to community providers. What we don't want to have happen ever is that young people are meeting their community provider or their principal at their school that's outside of our environment for the first time when they're already in the community. We want to do warm handoffs where you know the name of a person. We know that young people will be much more successful. Somebody is going to make fun of me later for using the word kids this many times in one presentation. So my apologies to anybody. It is a change in language for us. And if I were 18, I would be offended by being called a kid. So certainly my apologies there. Next slide, please. Now I'd love for somebody to call to like, you're so youthful, but it's a different world when you're 18 and you're trying to claim your adulthood. Our behavioral health investments, we did have a pretty substantial investment that we have embraced and run with, and it is really impacting young people positively. We are seeing that it is actually, I think, more than we thought of our population have co-occurring needs. We are seeing very high levels of opiate use disorder. We onboarded treatment specialists in almost every unit at secure facilities. I think we have one open right now, but they are going to be DBT, so they'll do dialectic behavioral therapy at a deeper level. So historically, there was kind of this DBT light perception in juvenile rehabilitation that everybody did it and we did it kind of okay. And we've shifted some of that. Our counselors will still do dialectic behavioral therapy, but they will not be, case managers will not be responsible for doing it. And we will have people who are deeply trained on the model. We also have aftercare liaisons at the 8 community facilities and in the regions. And I was just out in Eastern Washington last week talking to some of these folks, and they're so excited about this work and these investments. So for everybody who is involved in that, thank you. And then measurement-based care, leaning into some systems where we can, it's the evaluation of systems or symptoms before, during, and after treatment, and making sure that we have a way to measure that. So we have a pilot program with a system called OWL that many community providers use that may increase the efficacy of the services that we're able to provide. And then we are presenting in a week on Results Washington Goal 4.2, which is behavioral health and community, increasing our peer services and workforce opportunities. We've really engaged in that in some cool ways. And again, I'd love for the peers to be able to share their experience as our most recent person engaged in peer support services just released from Green Hill last year. And is doing an incredible curriculum at Touchstone Community Facility. And we continue to develop capacity to work with different kinds of professionals, including like the instructors of yoga behind bars who were incarcerated as juveniles and then went into the adult system and now are now back serving in this capacity and have a lot of wisdom to share with our population and a lot more credibility than those of us who have not shared that experience. There's deep power in representation. We know that, and we want to make sure that we're serving in that space. Next slide, please. All right, Andrew.
Yeah, so related to assessments, we've been doing a lot of work to improve assessments in JR. Some of the historical instruments that were being used to inform decision-making, we did some analysis and found that they were designed to predict certain outcomes, particularly recidivism, and they weren't particularly accurate. And we found some areas where there was some equity issues related to how it was predicting. And so we've tried to unwind a lot of that assessment work and are rebuilding it. Much of this work is funded through 1186 and the community transition services, but I think what we're creating will certainly benefit all treatments and services in JR. A big part of it is increasing reassessment. So previously we were doing our main assessment at intake and then at release, and particularly given the longer JR sentences, the need for a reassessment is greater. And so we're going to be reassessing you every 90 days to get a better understanding of what their needs are so that those can be matched with treatments and services. We're also aligning our assessment with the courts. So the courts have updated their assessment to the the JCAT juvenile court assessment tool. And so we're aligning so that we're asking similar or the same in most cases questions that the juvenile courts are asking of youth. This is going to be building on, assessments are really our x-rays, right? And our information to know what treatments and services to provide youth. And we're moving from the idea of risk, and there's some challenges with that we can talk about if anybody had questions, but more to needs. We can identify what their needs are right now and how those are changing, and making sure that they're getting high quality treatments or services to match those needs. And so that's where the specialized treatment of DBT will come into play, and many of the other changes. But this assessment work, I know some say it's taking a while, but there's great progress happening in terms of updating technology and updating the assessment tool that's being used.
Thank you so much, Andrew. It really is making a huge difference that we are looking at dynamic risk and making sure that we're putting young people in the programs that are most responsive to their need right then. So that
please,
shifts.
can I interrupt you for just a second? It's Representative Dent here. I just want, for full disclosure, I just want the folks, our board members and also the people listening in here, that both Andrew Fox and Haley Lowe are here to support you in your presentation here, and we didn't have that information out there. So, we'd like people to know, why they're here and why they're talking. So I appreciate that, and my apologies for not saying that sooner. And thank you for what you're doing.
Thank you. And my apologies for not, adding some stuff there and just throwing people into our presentation. So it's been a really big deal that we know that 1 week a young person could have a high need in, that they need substance use disorder supports. And the next week, mental health could overrun that. And we need to be able to be responsive. And if we're not reevaluating every 90 days, one, we don't see progress. And we don't see where we might not be meeting their needs. And we are really committed to making sure that we're not housing kids without the resources that they need so that they can be as stable as possible and realize their full potential. And the refocus of the counselor duties was put in place. So the formal changeover was July 11th. So there's still some work to do, and like everything, it is evolving because it involves a lot of people. But it has been a firm commitment to us going a little deeper with this level of service that we're doing. Next slide, please. So we just, back to our national involvement in trying to be innovative and trying to commit to the highest level of professionalism possible. As Dr. Fox talked about, we're just completing our capstone in room confinement with Georgetown. That should be done by October, and has dramatically, that work and that group has done such beautiful work. What we know is that when we put kids in room confinement for even the shortest period of time, it can do harm. And so our commitment is making sure that we're not doing that. It's scary, it can cause trauma, that we should be engaging with kids throughout the process to assess their commitment to safety, to come out as quickly as possible. A month ago, we were selected by the Council of Juvenile Justice Administrators for a new technical assistance and training, which is length of stay. States that have been through this process have dramatically driven down length of stay at every step. So secure confinement, community facilities, as well as probation. We're one of the first states that doesn't have one system that runs it all. And they are particularly interested in us for that reason. The goals that we were selected based on, and it is a 15-person team with people from across the state that are not just from JR, that will help us through this process. Our kickoff meeting is next week. And our goals, as stated in our application to them, were to address racial and ethnic disparities in length of stay, address patterns, have our data analyzed by people outside of Washington, as well as our Office of Innovation and Alignment, which often tells us, whoa, this population is overrepresented in this space, and to try to figure out what to do about that. And then also improving our outcomes for young people in the time they have with us by making sure they're in the right program at the right time. And then our third commitment is to make sure that we are not lengthening the time that a young person spends in JR due to incidents or other things that could lead to new charges. So what is the impact that we can have in that space? We're really excited about the process, and I'll look forward to updating people as we get into the technical assistance. But states that have been engaged have Oklahoma being one of them, have driven down the number of young women in systems. We now have Hawaii that has 0 young women in a secure care. So we're really looking to how can we drive down that 370 days within our ability. Next slide, please. So and then in opiate use disorder treatment, I've talked about this a few times about kind of the rates and the surprises here. Our juvenile rehabilitation medical director is running the Helping End Addiction Long-Term initiative. We have one of 10 opioid prevention projects in the nation. We have trained every staff member and young person in JR in how to use Narcan. We have Narcan available everywhere in JR. I think we have a really cool and accessible training. And for young people who are releasing to community or who have had exposure, we teach them kind of what are your rights around administering Narcan. I don't know why that was hard to say. And then we leaned into medication for opioid use disorder. We are doing mostly Suboxone in that space. We also provide opioid education materials on our secure laptops. That was an initiative during the pandemic where we have secure tablets for all of our young people. They have all kinds of materials that the kids like, some that they probably don't love, lots of TED Talks, lots of interesting school enhancement material, a few games, and we can upload different content each year. And then the grant is under review to extend. We're in year 2 of this particular grant, and they get wraparound care through the grant if they're identified as people who have experienced or are experiencing opioid use disorder. Next slide, please. And then our emerging adult program enhancements. So again, back to the JR to 25 population. This is a population we had not served. And so there's been a lot of training. 15-year-olds are pretty different than 18-year-olds, and their expectations of the adults who are serving them are pretty different. And so we had a lot of work to do in ensuring that we had post-secondary education options. That is more challenging than we, I think, thought it would be, because, I mean, fortunately or unfortunately, we have less people in care than we ever have. What it increases is when you're trying to engage in a contract, the amount of people that can serve 3 young women who need to go to college becomes way more complex. You're not getting a professor to come in to talk to 3 people. And so we've contracted with places like Highline Community College to make sure that we are getting the education that the young people in our care need is if they're done with their K-12 education. We've increased our job readiness, employment, and career programs. We implemented the secure laptops, which every young person in our secure care has. Increased our vocational programming. The most recent thing was opening a beauty school at Echo Glen. We are opening a barbering program shortly at Green Hill School. Increased transformational and peer mentoring, which is a really good way to engage some of the young men and women that came back from the Department of Corrections. Implemented higher level legal advocacy and are working with our partners at Team Child on that, as well as the community assisted reentry. The three areas that we continue to work on and that are not fully implemented are the community transition services, which, to Dr. Fox's point, we want to do this right. We want to really lean into needs. And I am one of the people who is consistently pestering him about, why does it take so long? And it has to be done correctly the first time. And it is a dramatic change, or it will have negative impact on the young people that we serve. And parenting support programs. We now have more young people in our care that are parenting than we ever have as well. So accessing programs for them to support them in parenting, as well as independent living skills. And we do have some supports for independent living. We continue to grow that program based on, because it's complicated and it is driven by young people. In the last 2 years, the needs of young people have really changed through the pandemic. I think we keep listening to, like, what do you need? And even with our formerly incarcerated team members who come in and provide service, sometimes they don't know. Like, somehow the disconnect, the age gap has become bigger during the pandemic. And so we're trying to be really responsive to that. Next slide, please. And then these are just some of the supports that we have in action. And you can find more information about these in the annual report. And I am always available for questions either in this meeting or outside of this meeting. But you know, you can see the post-secondary, our transformational mentoring, Roots for Success, a personal fitness program where young people can get a certificate in personal training and nutrition. Post-secondary through Bellevue and Yakima Community College. We're working with Perry Tech. We've done construction trade programs. We have a barista program, increased our Canine Connections program. Actually, we didn't put it here because it isn't a jobs training program, but we are fostering kittens at Echo Glen, which helps everyone's soul. We have kittens and puppies and coffee, all of the things that people need to be really happy. And continue to kind of hear from our population, what is it that you need? But, you know, some of the basics are making sure people have ID, license, social security card, anything that's going to be a barrier to success once they release. I'm trying to rush through this because I want to make sure that I give our education administrator enough time to cover her slides. And just so that you all know, JR had not previously had a K-12 administrator. So this was a service gap. So Haley has joined our team on June 1, in order to be able to fill that gap. Next slide, please. And then very quickly, the nacelle closure has been complicated, and I just wanted to give an update about where we are. Our client closure is no later than September 15th. That will depend. We are down to 5 young people at nacelle, and we will make sure that if they are enrolled in K-12, that they're in their new school district by the date that the school. So that's why it's no later than September 15th. Of those 5, we'll be looking at them to make sure that their educational needs are addressed. We have transferred most of the young people at nacelle. Again, we were at 30 when the closure came about, and very quickly, without the ability to have intakes, the population dwindled. We are in the process of staff transfers to other jobs, including some at Green Hill. We have supported staff through the closure process, acknowledging that it is incredibly painful to go through a closure. We've done things like resume writing, peer support, sending in our staff peer support team several times to talk through things with folks, a job fair, relocation support, including a moving assistance stipend that we've given people, as well as my commitment to the team there that we would do weekly frequently asked questions from the team. So yeah, it's been complex and also driven by the fact that JR staff have done incredible work over the last 20 years and that our population is down. And I think while closures are incredibly hard, we have done it in a way that shows dignity for the staff and young people in our care. With that, I will turn it to Haley to talk about our advances in K-12.
Thank you, Felice. As was mentioned, my name is Haley. I use she, her pronouns. I'm joining you from my home in Olympia, the ancestral lands of Nisqually, Cowlitz, and Squaxin tribes. And next slide, I have the pleasure today to share with you some of the amazing transformation that is underway in education in JR. Felice and I had the opportunity to work on education when she was in her role as superintendent at Echo Glen, and I was in my role as director of student support at OSPI. This was in the middle of the pandemic, and the story that we would have told you then is very different than what we're going to share with you now. We are extremely grateful for the legislature for passing House Bill 1295. We have been examining the challenges in institutional education for years, and we have a lot of data, and what we didn't have was a roadmap to the solutions. And the roadmap to the solutions is clearly outlined in the recommendations of House Bill 1295. And, the foundation is that every student can succeed if given the necessary supports. I know there are people in the Zoom room today who have followed education in JR and at Echo Glen and know that we have had significant challenges. And the challenges have come from not having the supports that this group of students need. We don't have time to spare. We need to make sure that when they arrive in our facility, we have educators and staff that are prepared to meet them where they are at in their learning. And we have the privilege of working with American Institutes for Research, as well as Just Leadership. Just Leadership is a national organization that is founded and operated by individuals with lived experience of incarceration. And they lead with the motto that those that are closest to the problem are closest to the solution and often furthest from the decision making. So we are really learning a lot from this group of individuals, focusing on youth voice and youth engagement, knowing that we need to hear from the students what their needs are as much as we need to lean to the research and data that we have. We're working really closely with the Office of Superintendent of Public Instruction. And we also have, as part of House Bill 1295, we have an advisory group that is helping to advise and inform our work. And next slide, please. And this is really about, access. Student support and student needs is how do we remove barriers and increase access? Knowing that education is often a springboard out of poverty, out of incarceration, we want to make sure if a young person arrives, like I said, in our care, that we are resourcing them and equipping them with what they need to move forward in their future. So this may be post-secondary, as Felice mentioned, we are serving an older population who have their GED or they have graduated from high school. Some want to pursue post-secondary, some career. Again, we have an opportunity to make sure that we are providing the right supports and resources while they're with us and moving as they move and transition to the home community, making sure that that gap is closed, that they have a clear roadmap and a pathway forward, and that they have people in their home communities waiting for their arrival. So a lot of the work in equity is not only what we do while we have the students with us, but that we ensure that when they leave, they feel confident and secure in the direction that they're going with their education and careers. And so yes, an example of that is the Strength and Connection and Partnership with the Issaquah School District. We have, so 1295, a lot of that is working on a set of recommendations. And we know that we couldn't wait for these recommendations of 1295, that the work of improving education needed to happen right now. And we have, even prior to the arrival of a new principal at Echo Glen, we had a group of professionals that were really, really dedicated to going above and beyond and doing whatever they could in their power to help support education. As I said, we've been examining the problem for a while. We know that institutional education has not had an update to the funding model since 1997. Money isn't the solution to every problem. However, it does help to be able to have a fully staffed school. When we think about the needs of our students, as you saw in earlier slides, about 50% of young people learning in our schools have special education. And specially designed instruction is the key to ensuring that each student's individual needs are met. And that simply wasn't happening. And it wasn't for lack of interest, it was for lack of resource. So we know that money isn't the answer. We know that it is really a coordinated effort in how we partner with OSPI, how we partner with our school districts, how we partner with community-based organizations. One of the goals of this work is we want to be able to bring communities to the school. Young people having the opportunity to form positive relationships and feel a part of community is really important. And in public high schools, that can happen through internships, field trips. While we don't have the opportunity to do that, we are able to be creative in how we bring opportunities into the institution for young people to learn. I make talking points and then I don't follow them and I start going off on a tangent, and I know we're short on time. So I'm going to go back to my talking points. Next slide, please. So you'll see equity, equity, equity. We are, that is the key. The key is making sure that each student has access to the supports and services that they need. And we are going to be able to do that through the recommendations that we're developing through House Bill 1295. And it's about relationships. So meaningful engagement is not only creating content and opportunities for young people to feel excited about learning, it's also about having adults and educators that know how to build relationships, that lead from a trauma-informed lens, and really, really have a heart for and want to work with this group of students. So expanding opportunities. One of the examples, we're working with Pongo Poetry at Echo Glen, and that has mentors coming in and working one-on-one, writing poetry. At the end of a Pongo workshop, young people have poetry that they've created that's an expression of themselves. They see themselves as learners, and that's been really exciting to witness. There's other opportunities such as edible gardens, exposing young people to opportunities that they may not have had before. So the meaningful engagement is key. And then, as I said when I started, that clear plan so that when they leave, they can continue to grow as learners and scholars and see a future for themselves that they may not have seen when they came into our care. Next slide. So the key components of the bill, the first one in that establishment of an organizational and accountability structure, that's going to be critical. So we know right now we're working on the recommendations. We also, as an organization and agency, we need to have a roadmap for how we're going to implement these recommendations. We know that we can make really great policy. And if it's not implemented well, it's an empty promise. So we want to make sure that our work, when the recommendations go to the legislature in November, that we have a plan for implementation and that we have that ongoing accountability structure to make sure that we are doing what we agreed to do. And OSPI right now is working on an updated funding model. I will not go into funding. It is too complex for me. However, I know that they are looking at what are other typical schools receiving. And we know that we can learn from that, and also that the needs of the students that we are serving are complex. So we have toured different schools, and one school of interest is Renton Academy, and they specialize in working with young people with significant behavioral health needs. And with the foundation and educational delivery model, they have had really great success in engaging young people in learning, often returning back to their home schools. Some just do better in the Renton Academy environment. And we are working with Dr. Lisa Hoyt, who was the founder of the Renton Academy. She is working with JR in partnership with Issaquah School District to develop an education delivery model that is designed specifically for the students at Echo Glen. This will also transfer to Green Hill. And as Felice mentioned, that is an older population. At Echo Glen, we see middle school, high school, and the young women in JR to 25, but the needs are different at each institution. So that's an exciting part, because we can have the recommendations, but what we need is, what is this going to look like in the classroom? What are the expectations from educators? What can students expect to receive when they attend school at Echo Glen, Green Hill? And we're also working with our community facilities to look at how education is being delivered and opportunities for improvement in those areas. And yeah, so the funding is part of it, but this really is, it's exciting. A couple of years ago, I didn't have a lot of hope. I had more concerns, and I am excited about the work that's underway. We invite you to continue to track the work that's happening, ask us questions if you want to get engaged or know more. The OSPI website has the full list of advisory group members and the interim report that was submitted in December. That is the high-speed overview of the transformation that is underway in education in JR.
Thank you, Haley. Appreciate that in-depth overview there. So, also to Andrew and Felice, it's been a very, very interesting presentation from everyone today. I have learned quite a lot. So this is our time for questions. So I see that Representative Sen has her hand up. Representative Sen.
Thanks, Chair Dent. So this is really a comment. You know, I wanted to welcome Felice, and obviously new energy and then a fresh look is very exciting, and lots of headway being made already. And I'm so heartened to hear the report on the K-12 education. It was on my list of things I was going to ask Felice, but hearing from Haley was key. I remember we went and visited Echo Glen, and it was shocking how little education they were getting, how just clearly that was not an emphasis in any way, shape, or form. And after many years, we finally got some traction and really, passed the legislation and really been focused on this. So again, with the specific or particular acknowledgement that 50% of these kids have special education needs, and there weren't any mental health providers, and just one could go on and on about the deficits. I'm so excited and heartened to hear about this emphasis, and the work that's being done. And I look forward to it, you know, continuing to be improved. And so I just really wanted to call that out, because that is, you know, it was not part of McCleary in any way, shape, or form. And so it was completely just, you know, a stepchild, an unwanted stepchild. And I'm thrilled to know that you recognize that you're wanted, and and that we're welcoming you into the family. So anyway, I have other things, but I just really wanted to highlight that, and thank you guys for that. And I guess I would say, and to thank really for the emphasis on the mental health for these students and the services that, you know, Felice, you summarized, that was really focused and happening, because that was the other component that was also very clear, that there was not enough and there was not an attention to that. And that was a massive component of kids coming in, and certainly their needs there and the continuing needs on the way out. So thank you, thank you, thank you.
Thank you, Rep. Sen. Lois Martin has her hand up.
Hey, sorry, I had to unmute and move a few things around. I have a couple of questions that I wanted to ask. I just wanted to find out about the reception from staff and the young people about the new programs that you acted, and how they've been received, as well as how you're tracking them to see if they're impactful. That's question number one. Question number two is about the new employee academy, and wondering how racial equity training is being incorporated into that. And then my third, well, I have four questions, sorry. For the 1186 funding, is that set to end, and is there an ask for the upcoming legislative session? And then my final question is, are any other states using the assessment tool the model that you moved to, and how effective has it been for them?
Sorry, I was writing to make sure that I got the four components, and I think I missed one. And I may kick part of the answer over to Andrew so that I don't answer maybe as ineffectively.
Felice, do you want me to go through them again?
No, I think I have them. Just let me know what I'm missing as I go through. So I wrote, the first was around programmatic, kind of how people have responded to it. We're doing pre and post on almost any new program. I'm sure there's an exception to that, but staff overwhelmingly it's been positive, that it is increasing their efficacy and giving them the tools to best serve young people. We're not asking people to do more with less. We've been really thoughtful about the way we're resourcing things. I think historically pushback has been around, I can't do one more thing. So like the yoga behind bars, we've done a lot of pre and post analysis of what staff perceptions of it have been, and their growth has been really good. Our racial equity training that is part of New Employee Academy is done by our Office of Race, Equity, and Social Justice. And we're now making sure that every employee that comes on is doing DCYF's Res J training. And I think they're speaking next, so they can talk a little bit more about the intricacies of that training, but we are making sure that nobody comes into this work without doing significant work on populations that they may not be part of. With the assessment, this is work that our Office of Innovation and Alignment is working on. And I think I may say this right, but Andrew, please jump in if I'm wrong. They're developing this. We did meet with a lot of off-the-shelf contractors that do assessment to see if that would work for us. No other state has this exact assessment, which is why it's being evaluated in the way that it is. Go ahead.
Yeah, it is almost identical to what the courts are using, the juvenile courts in Washington, and very 95% the same as some other tools that are used across the country, particularly Florida uses a very, very similar tool. The challenge is the local implementation and monitoring and local validation of the tools. Taking one off the shelf and just plugging it in, that might work for some time, but being able to monitor it and continually update how it's used is really the key here. And I want to add that I forgot to mention earlier is the agency has stood up an assessment oversight group that oversees the assessments for the entire agency. And I don't know if the oversight board has heard from the AOG yet, but it's a brand new thing that is really giving us the mechanisms to kind of guide and make changes to the assessment tools in the agency, where before it was very sporadic and it was hard to know who had authority over assessments. And so that's been a really good development that's giving us the avenues to make the necessary changes.
I think we did miss one question.
Okay, thank you
there.
both.
Did we miss a question?
And that was just about, I know you had mentioned that a lot of the funding was coming from 1186. Is that correct? So I'm just wondering, does that have an expiration date, or is there an additional ask in this upcoming session, or what's the plan to continue to fund these type of programs?
There is not an ask in the upcoming session, and there is ongoing funding. We're just in implementation phase, and really grateful to be able to be doing that. Thank you.
Thank you.
All
So Dr. Levy?
So I also have two questions. The first one is for Haley around assessments when you have the youth coming into your program. We know that standardized testing is not always the best way to assess children of diverse backgrounds. And I wondered what your approach was in assessing them for educational needs when they enter the system.
Yeah, that is one of the areas that's really our institutional ed teachers and practitioners are looking at a standardized and intake process that is really designed for the reasons that you said, knowing that the young people coming into JR often they have not been engaged in education, the significant amount of trauma that they've experienced, like taking in those considerations and having an intake that is designed. Again, this is buy-in for when we talk about, this transformation that's underway. We are looking at every aspect from, when the young person arrives at the detention facility, how do we begin planning for education at that point, knowing that at detention, that's often they talk as triage, just, taking care of their immediate needs. And so when they do come to JR, we are working with the two principals and OSPI on a new intake form that will include assessments given the particular circumstances of each young person that we work with.
Great, thank you. And then my second question, it has to do with outcomes. As the Oversight Board, we're responsible for looking at outcomes, and you have such a wide range of what sounds like wonderful programs. I know it's a little early to get outcome data, but I wondered if you could address what your strategies or what your intentions are in terms of thinking about outcomes of these programs and how we're going to be able to monitor their success.
Yeah, I mean, every implementation does have a follow-up plan where we're going in to see if it's having a positive or negative impact or no impact, because we only have so much time in the day. So we want to make sure that each program that we implement has goals that impact as many people as possible. For some of our programs, that's going to look like graduation rates back to the plug for our annual report. You can see some of the data already, because I don't think it's too early. I appreciate you saying that it's too early for outcomes. I think you can probably sense the urgency from all of us, with Haley and I with 1295 and with institutional ed. We weren't going to let one more kid go through a system where they weren't going to feel like a scholar and they weren't going to feel like they could graduate. And so you can see our 5 GED graduations, as well as all of the enrollments at Green Hill School and community college, with, Yoga Behind Bars is a nonprofit. So their outcome report comes in the form of their annual report. It's a program I didn't talk about earlier, but we're doing edible schoolyard at Echo Glen also. Really emphasizing nature-based programming for the young people that we serve, having to do with vegetables, and some equity and justice in growing things, and making sure that we have gardens available at all of our community facilities as well. Canyon View just opened their Indigenous medicine garden with the help of some partners at the penitentiary in Walla Walla. And we hope to continue to expand those kind of opportunities too, that I think are hard to quantify, but when you talk to kids, it's changed. I mean, the young man who did the sprinkler system, who might be 17 at Canyon View, I don't know, pretty spectacular system that he put in, but we will ensure that for everything that we implement, we have a way to measure an outcome, but that's going to look really different across our programs because they are so diverse. I hope that answers your question okay.
I'm just going to add a little on I think certainly there's the long-term outcomes of recidivism and education employment, but one of the benefits of this reassessment every 90 days is going to be our ability to look at changes in need and dynamic risk while they're in programs in JR. And that's one of the big benefits as an outcome, to see how they're changing before they get released, so that we don't have to wait 3-4 years for the recidivism data to come in to know if what we did worked. And so the new assessment process will allow that more immediate analysis of changes in their needs.
Thank you. Representative Kagi.
Thank you very much. Well, it's just so encouraging and exciting to hear the progress that has been made over the past couple of years. About 6 or 7 years ago, when the legislature was first starting to think about JR to 25, a group of legislators and advocates visited McLaren in Oregon, which was a model for that we wanted to replicate. And 2 things were really apparent. One, the very positive role that the older youth played in mentoring, and I'm really happy to see that being developed in our own JR to 25 program. But the other thing that was striking was the role of the construction trades and unions in the training programs that are offered at McLaren. And most of those youth and young adults were leaving McLaren with a union card, having been fully trained to go out and get a job. And I just wondered, you mentioned training in the trades. But I'm wondering if that relationship with the trades has developed so that the youth can leave with a union card that will basically guarantee they can get a job.
Yeah, Oregon is a state that also is on the Council for Juvenile Justice Administrators. So the Oregon director and I've been able to learn as I orient to this position, really learning from people who have been in these positions a lot longer than I, in states that are super progressive and doing great work, has been really fun. And McLaren's pretty wonderful. And yeah, we did learn a lot from their peer support. And we do have some people leaving with union cards or pre-apprenticeship. We have a couple of different building trades programs at community facilities as well as at Green Hill and one at Echo Glen. I think we can continue to lean into those relationships with the trades unions though, and there's some development to do there as we move forward. They've had longer time in this process in Oregon, and so we will continue to learn from them and make it more immediate like you're describing, because I think there's some real power in leaving with your card ready to work. In my prior life, I was at the women's prison as their associate superintendent and watched women leave the trades related apprenticeship coaching program with a union job out of the door, and the impact that that had was incredible. So we certainly want to replicate that.
Well, I just want to congratulate and thank you for the leadership you're providing. It really is very hopeful.
Thank you. We're really excited, all of us. JR has the best team. Our folks, I have to say in front of you all, they showed up every day of this pandemic and gave it their all and never made an excuse about not being able to innovate, and let me push them around a bunch. So I should say that more nicely, but I'm eager to get a lot of things done and people are excited about it. So that's been really fun.
Well, thank you. I agree with Representative Kagi. I really am encouraged when we are training our young people to go out and, and have a living wage job where they can, afford a house and they can take care of a family. And I think that's so important. And I see you working with that the institute out of Yakima there. I'm always encouraged when I visit them, is because those kids, they all have an opportunity to leave there. They all have a job when they leave if they want it, and they go into the world and they're ready, and that's encouraging for me. Is there any other questions? Because I have Representative Kagi, do you have another question? Your hand is up. Okay. Does anyone else have a question? Because I have a couple. I was waiting to the end, but I would defer to anyone else. Okay, so a couple of things that kind of went through it. I mean, I actually have a whole list of questions, and I probably won't get to all of them, Felice, but early on, you said the age of the average age in the JR is rising, and I think you said from 16 and now it's up to about 18. Do you see that leveling off now, or you think it'll continue to rise?
I would give my perspective. I'll let Andrew give the actual data because mine would be a guesstimate.
Okay.
I would think that it will continue to rise for a number of years as that group, because we can go up to 25, right? And we're seeing kind of a cohort in there that are 21, 22 right now, a few that are 23, 24, but as that population that's committed in JR to the age of 25 ages, I think our average age will continue to go up for another couple of years until that process is full.
Okay, thank you for that. And the next thing I think was in the second section, you said that, and you may have answered this question, sometimes I miss things, but on the unfortunate things of a Zoom, sometimes we have other distractions, in the room, but you said you have a high turnover with staff, and could you know what, can you identify is it a single issue, or is it many things that creates this high turnover?
I think historically it's been a lot of things. I've taken a lot of time to go through exit interviews at all of our sites, as well as staff safety surveys, as well as employee engagement surveys for the last 4 or so years. Certainly wages have impacted that, as well as vicarious trauma and untreated vicarious trauma, which led us to scale our peer support team. What we were seeing is, the adults that work in our system, sometimes the young people that we serve have complex trauma. And so you're going to see behaviors that are hard to metabolize. And we have to have the right supports in place for the people that work for us to be able to see something really hard, process it in a way that's healthy, not hang on to it and let it eat them up so that they can't do this work anymore. And so we're really leaning into that and listening to what people who have worked for us have to say about the work environment, how to stay engaged, how to see this as a career. Turnover over the last 6 years in certain spots has been, close to half. And certainly we, like everyone else, are dealing with extreme staffing shortages in 24/7s. And so trying to be creative, trying to be innovative in how we bring people on and how we make this a place they can live a life without, one of the things that ends up being a thing always is mandatory overtime and other negative impacts on your family if you work for us. That we shouldn't have employees who have to make a choice between, serving the young people in our care and being with their own children. There should be like some type of balance. And so really trying to lean into some innovation there as well. I hope that answers your question, but for most people, it's been burnout and the fact that they didn't really, I think in some spaces didn't feel seen for what they were experiencing when they watched a young person in crisis and having a space to talk about what they had seen.
Okay. Yes, that's a very, very good answer. I mean, well, it's a good answer, but I mean, it's a real answer, and I appreciate that very much. So thank you for that. And I do have several more questions, but I will try to set up something with you offline, and I'd like to learn a little more about, some of the things we're doing there. So does anyone else have anything they'd like to say? I'm trying to keep us a little bit on track here for time. So are there any other questions or comments or anything from the board they'd like to put out there for consideration? Representative Sand.
Thanks, Rep. One question I wanted to ask with the closing of Nacelle in particular, do you see a need for additional community facilities, and what's the plan, the thought there for expanding or utilizing community facilities instead of an institution?
Yeah, there are going to be a couple of asks in that area. One is doing some institution minimum readiness preparation. One of the things that Oregon does really well in their system is a co-located kind of community facility where there's a middle step between community facilities. So our hope is to change some maximum housing to minimum so that young people that are co-located that have high needs at Echo and Green Hill can also get some access and have a transitional step, or a kind of a transitional living is what it's called there, as well as a need to site a couple of new community facilities. Two institution system is very hard to operate. There's some complexities with crime partners, other things. And so we've really been leaning into, maybe the best historic example of that is when you have girls co-located with boys at Echo Glen. How do we ensure that while the numbers of young women are lower, that we're still giving them the same level of access and care? And so making sure, because I think sometimes we talk about like there aren't that many girls, there are 40. It's a lot of lives. And so making sure that they have access to the programs they need while they're outnumbered. So those are kind of the two things we're thinking about, or the transitional living center model, where you could still see your JR psychiatrist as you titrate to a community facility, and really preparing, making sure that our young people, what we've seen over the last couple of years is a lot of return rate to the institutions, and trying to figure out why and make sure that young people are fully prepared to be there, so that they're successful there and don't go backwards. So yeah, I'm sure I'll have a lot more on that. I hope that answers your question, but there will be some asks this year.
Thank you, Elise. Do we have any other questions or comments? Now's the time. Okay, well, Felice and Andrew and Haley, thank you for your presentation and your devotion and passion for what you do. It comes out, it surely does come out, and we appreciate you, and hopefully we'll have you back here one of these days maybe next year we can continue to see how you're improving and changing this the JR program. So with that, we're going to take a break. So we went beyond a little bit. So we're going to take a break until I think 12:05. Give everyone a chance to get up, move around, you know, have some refreshments, quick bite of lunch, whatever you need to do. So anyway, we'll see you in a few minutes. Thank you very much. Well, welcome back to the Oversight Board meeting. So let's kind of wait to see a few people come on. There we go. So we'll move into the public comment period. So I'll read a couple of statements here. We do have, I think at the moment, we have 2 people signed up for public comment. But we'll read the statement regarding public comment. Excuse me. So the DCYF Oversight Board is governed by state law. Per state law, the Oversight Board's authority includes monitoring DCYF's achievement of 8 outcome measures listed in DCYF's founding legislation, monitoring DCYF's compliance with applicable laws and policies pertaining to early learning, juvenile rehabilitation, juvenile justice, and children and family services, general oversight of DCYF's performance and policies, and providing advice and input to DCYF, the legislature, and the governor. The Oversight Board does not have authority to inquire into, direct, or change DCYF decisions in individual cases. For those wishing to provide public comment to the board, we would like to remind you that the board is subject to the Open Public Meetings Act, which means our meetings are open to the public and anyone can attend as an observer. Our meetings are recorded and posted on the Oversight Board's website and will be broadcast on TVW. We wish to inform everyone in attendance of this fact as an act of respect and support to individuals who may have a sensitive story they wish to share or wish to express individual case details in this setting. The Oversight Board may use any information brought to the board's attention as it carries out its role of general oversight and monitoring of DCYF. If individuals do not wish to provide public comment in an open meeting, individuals may contact the DCYF Oversight Board staff to get connected to the board's co-chairs. We're also more than happy to connect you with the Office of Family and Children's Ombuds if you wish to file a complaint about DCYF's action or failure to act in a particular case. And their website is www.ofco.wa.gov. So thank you. And also we want to acknowledge that we received written public comments that we shared with the Oversight Board members on Tuesday, the 19th. So these comments will be summarized and included in the board meeting minutes along with other public comments. So, well, that was a mouthful, wasn't it? So we have 2 people signed up for public comment. I'm going to struggle with this one. So if I mispronounce it, I apologize in advance. Zion Grael, is that correct?
It looks like from those in attendance, we're not seeing that Zion is on the meeting at this moment.
Okay, let's we'll move to Shayna Richard.
Hello, can you hear me?
I can hear you, Shayna. Go ahead.
Okay. I'm asking to read my comment out loud today to share the story of Oakley Carlson with hope that you will advocate to Governor Inslee for an immediate outside agency review of Oakley Carlson's Washington DCYF case. I am a founding member of an organization called Light the Way Missing Persons Advocacy Project. Our team members have been investigating and advocating for Oakley Carlson, the 5-year-old missing child from Oakville, Washington, since December 2021. We are working with Oakley's loving and courageous foster parents, Jamie Joe and Eric Hiles, to find answers for Oakley, whose last known credible sighting was on February 10th, 2021. Sadly, she was not reported missing until 10 months later on December 6th, 2021. Last week, I traveled across the country to Grays Harbor County to meet the people I have worked for the last 7+ months. There were some highs from this trip and some lows. I want to start off by telling you about the highs. On Saturday, July 16th, the Hiles, along with Light the Way, hosted Paint the Night Pink, a dinner and auction for Oakley, where we raised nearly $50,000 for Oakley's private reward fund in one evening. Watching people in Oakley's community come together to raise an amount of money that far exceeded our expectations was truly humbling. Oakley is loved by so many, and so many want her to be brought home. Why doesn't Washington DCYF want the same? Now for the lows. We drove to 177 Bartell Road, which was Oakley's bio parents' home and the location of her last known credible sighting. The first thing I noticed was how isolated their property was from the road and neighbors. I cannot imagine how scared Oakley was when she was being abused by her bio parents and no one was coming to help. It infuriates me to know that the Hiles and other community members made calls to Washington DCYF with concerns about Oakley and her siblings, and that they were ignored. At what point does Washington DCYF start to be held accountable for this child's disappearance? Where is the ownership? In June, Ross Hunter, the Secretary of Washington DCYF, was interviewed for a local news program about Oakley Carlson's case. The news reporter asked, "Who is advocating for Oakley? Who is answering questions about how Oakley was protected?" Mr. Hunter responded with a long, awkward pause and then failed to answer the question. So I ask all of you to think for a moment and reflect. If the Secretary of Washington DCYF is not advocating for Oakley, then who is? He also stated during the interview that the nature of this and these interviews are really uncomfortable. If he finds these interviews to be uncomfortable, can you imagine how uncomfortable Oakley felt when she was being starved, beaten, and locked in a cabinet under the stairs by her bio parents? As the Secretary of Washington DCYF, he should be the role model for his organization's 5 values: inclusion, respect, integrity, compassion, and transparency. Unfortunately, during that interview, he displayed none of those values while talking about Oakley Carlson, a missing 5-year-old child. Washington DCYF needs to be better and do better when it comes to Oakley. And this is your opportunity to tell the Governor Inslee that it's time for an outside agency to conduct a review of Oakley Carlson's case, just like Massachusetts did with Harmony Montgomery. Harmony Montgomery was found to be missing just 3 weeks after Oakley. Her case is an active criminal investigation, but they decided to overlook the privacy laws because they felt an injustice had been done, just like Oakley. Oakley Carlson was taken from a safe and loving foster home and left in a home with child abuse, drug use, and what ultimately ended in a devastating story of the missing child. If Washington DCYF focused less on meeting reunification statistics and more on the best interest of children, Oakley might be here right now. I imagine that she might be enjoying trips to the playground with Jamie Jo and Eric Hiles, the 2 parents who love her most in this world. Please help us in advocating for an immediate outside agency review of Oakley Carlson's Washington DCYF case. Show your support by pitching in, as Governor Inslee stated, and doing what is right. Sincerely, Shana Richard, Light the Way Missing Persons Advocacy Project. Thank you.
Thank you, Shana, for taking the time for your public comment. We appreciate that. Is Zion Grayel, is she on yet? Krista, can you see? No? Okay, we have someone else who wishes to give public testimony today, and all we have is her listed as jury file. So if you could come on and possibly identify yourself, please, and then go ahead with your public comment.
Hello, can you hear me?
Yes, we can.
All right, my name is Rona Black with juryfile.com, just so that you know who I am.
Thank you. Go ahead.
All right. Again, my name is Rona Black. I am a victim advocate from juryfile.com and also a survivor of complex child abuse and imprisonment. I thank you for the opportunity to speak to all of you today. And I'd like to start by saying that some of the uncomfortable things that I might say are said with mutual respect. I won't be saying anything that's triggering or hard for anyone to hear in that respect. I'm here today to support the human rights of Oakley Carlson, a 5-year-old missing girl, and I am here to be her voice in her absence. Oakley Carlson is missing from Washington State. She was removed from her biological family where she was unsafe, and she was only returned to them. She was not kept safe by Washington State. She was returned to this family, and a proper look at her case was just not there, it seems. Situation that Oakley faced as she had to walk back into the home where she endured this horrendous abuse at only 5 years old, and even she at only 5 knew that this would forever change her life again. The state of Washington, like many other states, has prioritized reunification over a thorough investigation into individual circumstances. This is highly unacceptable for victims, minor victims, not just these are minor victims. Today, 7 months into the investigation to find Oakley, it's her foster family who has fought for her autonomy and her safe return home, not the biological family who the state of Washington deemed as a stable, safe environment for her to return to. I'm unsure what this really looks like for Oakley, given that her legal home is no more. I hope that you will reevaluate your stance on reunification. I beg you to prioritize individual circumstances above blanket policies. For Oakley and for myself, who at 38 years old, I still face the devastation of a life that was much like Oakley's, and the only difference is that I'm here to tell you about it. Oakley is not. I thank you for understanding and allowing my compassion for the situation to be conveyed today. I also plead for the state of Washington to finish what you started. You removed Oakley from her home. Your work here is unfinished, and an independent review is vital to minor victims. And again, I thank you so much for letting me be heard today.
Thank you very much, Rona, for taking the time to share your comments and your feelings. We appreciate that. Do we have Zion Grayel yet? No, Krista's shaking her head. Okay. So do we have anyone else? Okay, well, thank you to those again who provided public comment. We do appreciate that. It means everything to us. And we'll move into the next part of, we're 5 minutes early moving into our next part of our agenda here today. So it'll be the DCYF Racial Equity and Social Justice Team Updates. So similar to the topic of juvenile rehabilitation, the Oversight Board has not heard from the agency's Racial Equity and Social Justice Team since the summer of 2020 when it was newly formed. DCYF has identified eliminating racial disproportionalities and advancing racial justice as its top priority in the agency's strategic plan. Today, the board will hear how this work is progressing and what the agency is doing to achieve its goals of 1, becoming an anti-racist organization, 2, adopting human-centered co-design across the agency, and 3, ensuring assessment and programs are equitable across the agency. So today we have with us the Secretary of DCYF, Secretary Ross Hunter, and the Racial Equity Social Justice Administrators, Yvette Jasper, and boy, I hope Day Shogren. I hope I pronounced that correctly. So Secretary Hunter, you're front and center, sir. Good to see you.
You can't see me though, because the host has blocked me from turning on my video.
Well, we'll get to that. We'll fix that for you, since because I want to see you.
Okay. I'm not Rep. Sen though.
Well, this is true. We'll get it. Nicholas is working on it. We've been having some challenges today. We all went through that earlier.
Oh, there we go.
You are. There you are in person. Sorry.
Here we are in person and in one of the nearly empty DSHS offices, or DCY joint DCYF DSHS office. Kent turns out to be equidistant from where a lot of our folks are working these days. And we've been having a number of top level design meetings to try and integrate some of the changes that we're making across licensing, the service infrastructure, and our field teams. And this is the place where we're doing it. And boy, there's a lot of space here. I feel like I'm paying too much for real estate these days. So we have a slide deck that someone is presenting, or do I need to present that? Krista, you're doing that? Okay.
Nicholas has it.
Great. Okay, so that's me. It's nice to see you all. When we go to the next slide. Okay, so you've seen the strategic plan, a plan that we produced right at the beginning of the pandemic, which caused us to be, as you might expect, a little distracted for quite a bit of time as we emptied out these offices, figured out how to change all the things to work not in person, then went back to in person, trying to adapt. It's been an interesting challenge. But when we looked at the work that we wanted to do, eliminating racial disproportionalities and advancing equity, racial equity, turns out to be really fundamental to achieving anything else in this space. If you don't think about race, you can't safely reduce the number of children in foster care. You can't figure out transitions into adulthood if you don't understand the impact of race on the juvenile justice system, or the juvenile incarceration system. It's really the part we run. Same is true in early learning. It's also true internally as we think about our practice, as we think about provider services. How do we do that? So this has been key elements of what we want to do. And I've talked about this a little bit before. The three things in the middle: reducing the number of kids in foster care by half. And it says rate because otherwise our numbers, people yell at me because it's really a percentage reduction, not a harsh reduction in numbers. The transitions into adulthood for youth and young adults, both in foster care and in juvenile rehab, and the integrated birth to aid system are the things that we want to get done. And we recognize that we cannot do those things unless we improve what we are doing, the quality of the work that we do, and the intention of work that we do. This is ongoing effort, and improving the quality and the availability of provider services and actually referring to them. So the racial disproportionalities cuts across all that. I'm going to give you a little bit of a strategy or a status report about where we are. Let's go to the next slide. Okay, so those are the big things. These are the things that we actually are trying to do in the racial equity space. And I admit that when we rolled out all of these adjectives, I rolled my eyes a little bit. People have known me to do that in the past. And actually, it turns out they're all pretty important to do. Otherwise, I wouldn't put them on the slide. But we're going to talk about elements of this work. The design work is really critical. It's how do we do design so that it actually works for the families we work with? And some of the top-down design work that I personally would just love to just tell everybody what to do. Ruth is probably smiling there because she seen me do that before. It doesn't work. And so I'm learning new tricks, and we're really trying to do a lot of bottom-up design work. The assessment work is stuff that is really practical. And I give you an example. We had an assessment that we did on, we would assess every youth coming into juvenile rehab for their, what we would call their risk. And I don't know what it was risk of recidivism, risk of getting into a fight, risk of something. And that would affect the length of the time that they spent with us, right? Because it's a variable length sentence. And it could be affected over time, but that initial score would pretty mattered a lot in terms of sentences. And surprise, surprise, Black youth almost always had longer variable length portions of their sentence with us than white youth did. And people wanted to do a new design on this thing and all that. And finally I got to the point where I said, all right, we're just going to stop using this because it is just not fair. And if you're doing an assessment and kids of ostensibly similar risk, and you look at every sort of measurable risk factor, kids are the same, and the Black kids are always spending more time with you. Like, you're not doing something right. So we stopped doing that. Now we're doing work to replace that with assessments where we explicitly measure the impact of race on how they're played out and how we have quality control around implementing those assessments so that we don't get it wrong. It is so easy for all kinds of bias to seep into these things. And if you're going to do anything in the justice space, it ought to be just. And having it differ only because of race is not just. So you'll see examples of that as we go. Let's go to the next slide. Okay, so policy and planning wins. I'm going to do both policy wins, and then I'm going to dive into the actual numbers about how did stuff change. So we have created, as has everybody else, a pro-equity anti-racism team. And most of the instructions that came out from the governor's office on how to do this from the Office of Equity really replicated a lot of the community work that we did around building our strategic team. So we sort of moved on to the next level of that. And our pair team, we are working with to have a team that of people from the community who represent lots of different parts of the work that we do, look at the whole agency, not just like we have lots of advisory groups, dozens of them, too many perhaps, that give us feedback on specific elements of things. The child placing agencies talk to us, but we wanted to have someone look at all of our work with the community and hold us accountable for meeting these goals. You guys are part of that, but we also wanted to have a team that was really just focused on racial equity and involve people from the community. So that's how our pair team is coming together. And you'll hear more about that as we get into the fall. We've had about 3 meetings so far. I'm the chair of the pair team, and it's getting a lot of high-level attention in the agency. We changed a lot of policies to move racial equity around into higher level things, limited English proficient work, individuals with disabilities. How do we do policy around our LGBTQIA plus population? And I think the policy work, and we're happy to send you these policies. I cannot cite them chapter and verse. I think they're important, but they're not sufficient. You can't say, whoa, we have a policy and therefore we've solved all of our problems. It's just not true. We have more policy than anyone can actually read. So what's really important is how does this play out on the ground? And you won't be able to see that for a while, and we'll keep coming back to you and reporting on that as often as you ask. We also built a racial equity change team to try and get people from all over the agency at lots of different levels in the system, all of our divisions, all of our programs, and are going through a structured curriculum so that we have a shared language to use across the whole agency as we look at elements around what policies are we doing? What are our assessments? How is our treatment working? Does it get the same kind of results for children of color that it does for white children or Asian children? And then each team and division, and we're a big agency, so there's lots of work that has to happen lower down, is doing work consistent with that structured curriculum. And again, we can have someone come and walk you through the classes that people took. If there's dozens of people working on this, we have training that we're providing that is pretty extensive, like cohort level. This is not just you watch stuff on the screen and click the button in between making your dinner training. My favorite of those training programs is it's on the training platform. It used to be required that the safe driving training program that you do by clicking on your mouse on your laptop, with no evidence that it actually changes driving behavior. It's no longer required because I didn't want to take it. So we are trying to do real training that's involved. We're not yet mandating some single training course, because I haven't really seen evidence that single mandated training courses about implicit bias really change the behavior on the ground. So we're trying to get bottoms up design across the whole agency that's consistent, and that actually does change the behavior on the ground. Let's go to the next slide. So this is an example of some of the trainings that are available on our website. And I had them gray out the rest of the sort of the website navigation junk so you could focus in on. So these were trainings that were available. So there's one on Monday, you could take it. And I suppose if someone wanted to take foundational racial equity training from the Oversight Board, we could probably figure out how to add you into one of the classes. Let somebody know if you want to do that, because we probably have to screw with the learning platform. But these are not sort of simple one-off trainings. We've had hundreds of people go through this training. We're a big agency. We haven't had thousands yet, but we're really trying to get consistent knowledge across the agency. So we'll go to the next slide. And so this is one of those implementation cohorts I talked about of what are this is the curriculum that people are going through. So how do we build assessments for people? How do we do action plans? What are the tools that we have to actually look at our data? How are we doing promotions? How are we doing? I want to have us look at the system across the whole system, but I also don't want to just have it be 1,000 points of light. I'd like it to be a little bit more structured. So folks are moving through this in a structural way to do this. And I'll go to the next slide. Okay, so here's the part that I like. That's all the policy work that you actually have to do. The part that I like is, how did the world change? How did you actually move real things? Next. Okay, so children in out-of-home care are disproportionately children of color. This is sort of well known. It's not true. It's not only true in Washington, it's true everywhere. The long history of how race affects the foster care system, or how the foster care system affects race, is painful to understand. The two lines on here show the different ways of measuring this system. I tend to use the orange line, which is a snapshot as of a single point in time in a year that shows how many children are in the system. And that's at the end of 2021. We're now down to 6,600, about a 27% increase from when we started in the just over 9,000. Reducing the number of children in care, unless you do it in a really strange way, has a disproportionately positive effect on children of color by having fewer children experience trauma. The purple line is a way that Dr. Ibarra would typically prefer me to talk about it in public, which is how many kids came into foster care how many kids touch the foster care system in a given year. And this measure emphasizes more entries will have a bigger impact on the purple line than exits will. The yellow or orange line, depending on your monitor, tends to have a more balanced measure of entries and the length of stay. What the purple line shows is that most of the work that we're being successful in here shows about the same sort of percentage reduction in the system. A little bit harder, you can see this is a steeper decline, is that we're having more success at being thoughtful about who comes into foster care than we are about affecting length of stay. In fact, we're not really having a huge impact on length of stay right now. It's getting worse, and I'm very concerned about that. And it's very challenging. It's particularly challenging in King County. Our average length of stay is over 600 days. King County is around 900 days. I think that's right. Might be 800 days. Significantly worse than the rest of the state, and like almost a year worse than the rest of the state. We have to figure out, we have to work with the court system and figure out how to do that. It's not the only measure I care about, but we really want to, like, having kids linger in foster care when we could have come to a resolution is not helpful for anyone. I'm not an enormous believer in the exact 15-month time frame, but I am a believer that we should not allow children to linger, and we have work to do in that space. So I tend to go quickly over this because I live with this data all the time. Are there questions that people have about this, or do you want to wait till the end and we can come back to them? Representative Dan, how do you want to manage that?
Yeah, let's just wait till the end, and then we can ask
Okay.
all the questions we have. Thank you.
Great. I will then slow down my speaking so that I have almost no time left at the, no. Okay.
Well, in that case,
No, I'm fine. I'll
just
just
interrupt you.
continue.
We'll go right after you.
I'll continue on. I've never done that on purpose, he says, with his tongue firmly in his cheek. So I think I've covered what I wanted to cover on that slide. Actually, I will say this. We are, now I'll say this when I get to the next slides. Let's go to the next couple slides. The next one. So you've seen, oh, no, just back one. Okay, you've seen disproportionality indices from us before, I think. I'm sure we've had that presentation from OIAA here. But I'll restate what these charts mean. So if you just look at the overall reduction in the number of kids in care, it masks what happens by race. This is disaggregating the same set of data. Now, this is unfortunately not the same time frame. This particular data series ends either in 2018 or 2017. These two are showing, the first one is showing intakes, second is showing removals. And this is a place where we have been successful in reducing the overall number. And when you look at, say, the green line, which is at the top of both of these charts, that shows the American Indian, Alaska Native lines. And in 2017, we wound up removing 2.2 times as many American Indian children. And if I move my mouse, I don't know if you guys see that or not, but that's that number right there. As we did white children as a percentage of their population, right? So kid is twice as likely to be removed, down from 3 times as likely in 2012. So that's a big change in an improvement. A world that was where there was no racial disproportionality would have all of the lines exactly the same as the white population at 1. So these are all relative to the white population, since that's the plurality of children in the state, sort of reorients it that, so you can see the differences. You see Asian and Pacific Islander children are removed much less frequently than white children are. And if we disaggregated that further into Asian and Pacific Islander as separate, you'd probably see pretty significant differences there. The Pacific Islander population is pretty small. The one thing that this chart masks, and all these charts teach you something, but if you don't really think about them carefully, you don't always get exactly the right lesson. Over time, more and more people have identified themselves as multiracial. And so the makeup of that population has changed some. And so when we looked at we sort of took an initial look at the decline in foster care population over the last several years, which is largely not included in these two charts. We said, they're all declining pretty proportionately. This is probably okay. Like we're probably not screwing this up, not doing something that results in us never removing Asian children, for example. You could imagine a strategy that reduced the number of kids in foster care that had wildly disproportionate impact. And we haven't done that by and large. When we sort of do some, and I would call them, they're a little more than casual, but they're not yet to the point where we'd print them. We look at disaggregating the multiracial category. Some people identify as American Indian and other, and that's in the multiracial category. If we combine that and the American Indian categories over the last couple of years, we're worried that there's a slight uptick in that group, and we'll want to address that. This is what doing this kind of work allows you to do. It allows you to see the impact that you are having and try and figure out, why are you having that impact? And if so, what can you do about it? Most of the impact in removals comes from the fact that intakes are wildly disproportionate. So removals in 2017 were slightly, for American Indian children, because it's the easiest to see the number. The removals in 2017 are here at 2.2. The index of we still got almost twice as many children in 2017, American Indian children intake as we would expect given their prevalence in the population. So most of the 2.2 comes from the fact that we just get more intakes about American Indian children. And so, yes, our system exacerbates it, but it's not adding all of the exacerbation. And we'd like to keep squeezing these to get those lines all closer together over time. There are impacts of poverty that affect race that drive some of this behavior that we can't fix in a child welfare system. That's stuff that we have to fix upstream, and fixing some of those things, fixing the difference in intakes will involve eliminating racism in America. And I think that's an important goal for the country as a whole, but it's not one we've taken on as something that we think we can get done tomorrow for the agency. It's a very big challenge. Can we go to the next slide? So this is showing the percent of children reunified annually by race and ethnicity. So another look at a different part of the child welfare system. And this is showing much more current data up to 2021. And I'll try and get the chart in the keys and the colors to all be the same the next time we do this. But the green is still American Indian, Alaska Native. What you see here are smaller numbers, and you're seeing some bouncing around, and some of the smaller populations have more variation from year to year. The white and Black or African American populations are larger than these other populations, and as a result tend to have less year to year variation. So these are not as far apart as other populations. Hispanic population has a higher percentage there. This are more ways for us to look at the effect of the system on children of individual race and figure out where do we have, I don't necessarily want to say bias, but where do we have a behavior that's resulting in disproportional outcomes? Could be implicit bias, could be explicit bias. If so, we want to stamp that out. And so these tools allow us to look at that. You're seeing here, these are more close together than they were a decade ago, and that is a good thing. You're certainly seeing a significant increase in the reunification percentages. So American Indian children a decade ago reunified at 45%, and now they're in the over 60%. So we want to reunify as much as we can. So let's go to the next slide. Relative placements are another tool that we would use to stabilize. Let me think of how to describe this and use the right frame here. Children do much better when they are, statistically, when they are placed with relatives than when they are placed with strangers. It's not 100% true. There's nothing that's black and white in this job. Everything is a balancing decision, but in general, relative placements are vastly better, and the effect size of the mental health improvement is not small. Because the number of children in foster care are disproportionately BIPOC children, increasing the relative placement rate across the system should improve outcomes for BIPOC children more than it does for white children. We've increased this. This is an important measure for us. It is structurally challenging to change. We've gone up quite a bit. A 6-point increase there is 13% or something since 2016. This is intentional. We have one of the highest kinship rates nationally. We have some counties, King County, for example, is over 60%. We would like to have all of these be over 60%. I'd like them to be 70. Dr. Barra is not convinced that I can achieve that and maintain safety in the system. We will find a balancing point in there. She's probably right, and I'm probably overly optimistic. That is often the case. It's good to have people who puncture your balloon. So there are some tools that we are doing to try and drive this. Child-specific licensure is one of them. It allows us to get resources to families that where we would be very, very, very happy to place a grandchild, but might not be less enthusiastic about licensing as a general foster home. The child-specific license should allow us to have a much larger fraction of our kin placements licensed. I would like to be at 100% so that for every child that's placed with a relative, and we are assuring the safety of that they get exactly the same level of financial and other support that a similar placement in a stranger's household would get. We're not there yet. We are intending to get there. Other things that we did, and I'll move out of child welfare a little bit here, not completely, but the child care system is one, particularly the working connection system, is one that disproportionately serves families of color. And we were very concerned at the beginning of the pandemic about what, like, oh my goodness, what is going to happen to the childcare industry. It does not have the kind of financial resources to make it through the system, and that we'd have an enormous number of families who had to go to work and couldn't. I'm looking at the legislative members here. Thank you very much for your financial support. We want to thank the federal government for the financial support that we've been able to roll out. And we've been able to do in a pretty racially fair way, we believe, to our provider base. We had quite a number of arguments about how should we give away money to providers, and we came to conclusions. Our conclusion was that doing it was more important than arguing about it forever. And we have rolled that out, and it's pretty traceable how we did that. You guys gave us a lot of priorities for the second and third tranches of that funding. And we did not lose a large fraction of our providers and of our licensed capacity. I don't think we ever lost more than 10% of the capacity of the licensed capacity. The actual capacity on the ground was significantly lower than that because our providers are having great difficulty hiring. The entire world is short-staffed right now. And that is, you can argue about labor. I think people have decided that they're not willing to work at jobs where they don't make enough to actually earn a living. And that's been a challenge in childcare that we are working through in a different context. Another element that I want to thank you all for helping us with this year, legislation passed that allows us to eliminate automatically referring families where they enter foster care to do child support enforcement. You guys rightly recognized that. I will say this as bluntly as I said in one of the letters that I wrote to the budget chairs on this one. The policy of doing this, every time you take $100 out, $100 a month out of a birth family's income, you extend the length of stay for their children in foster care by 6 months, which at a minimum of $800 a month in foster care support payments is insane. It's insanely damaging. It's damaging to children and families, and it's financially stupid. It also costs us $3 to collect every dollar in child support here. So thank you for eliminating automatic referrals. We are still referring abandonment cases and other cases where it seems appropriate. We're doing, as the federal government requires us to do here, a case-by-case analysis of this. The feds have changed their guidance on this a couple times in the last 3 months, and we're adapting every time they do. We continue to track outcomes in almost everything we do, disaggregated by race. I'm not going to pour you through all of those. You can see them on our agency performance page. Let's go to the next slide. Almost done here. You asked us to end referrals to NACEL that had the effect of essentially emptying NACEL by September. We expect to have no more youth there in another month or so. We have, I believe, less than a dozen today. 90% of the children there were more than 100 miles from their family. It took 9 hours to get to NACEL on public transportation, and you could not do it without staying overnight in that community. The children who are served by juvenile rehab are even more disproportionately children of color. And we were, I think, damaging them by having them as far away as we did from their home. Having the youth remain connected to their family is a key element of reunification. We've increased high school graduations at Echo Glen. We had 3. I attended 2 of the 3. I missed one of them. First, it was more than we'd had in 6 years. And so we've had an improvement in staffing from the school district that runs that program has incredibly improved the program. We still have work to do to make the education system for these children of color, largely children of color, equitable in comparison to the education received by non-incarcerated children. And if we as a society want to live well, we would do well by having these children be successful educationally. Another bad for children and financially goofy policy that you removed, the parent pay statute, where we required low-income families to essentially pay the cost of their incarceration. It again costs much more to collect this money than we were able to collect, and damage the chances of reunification. We also submitted a report on community transition services serving children of color this week. I think I'm done. Do I have one more here? Yep, I'm done. So maybe we can go back to pictures of people, or if you want to ask me about any of the particular slides.
So board members, do we have some questions for Secretary Hunter? Let's don't let him skate here. We need to make sure that we hold his feet to the fire. And incidentally, you know, several years ago, he suggested that I not let him skate when he comes to these board meetings, and that's were basically his words. So,
yeah. And since I'm in one of our offices, I'm wearing shoes, so it's even harder to burn my feet. You know, if I was working at home, you never know. I saw someone had their hand up. I don't know who it was.
I don't see one on my screen. So I have a question, I guess, or maybe it's a long question, but so we talk about anti-racism, and incidentally, I don't know how long the training classes are, but I find that very intriguing, and if I can do that, I would like to do that. So I'll have to touch base, but
let me see if we can figure that out.
Yeah. So, but within the organization, within your leadership team, and then within the entire organization, so. I would assume, and if I'm wrong, please tell me, but I would assume that, you know, part of becoming anti-racist is that we have more diversity within the organization. We have more diversity in our lives, and which I'm good with. I'm really good with that. So how are you working on that within the organization to increase diversity within the leadership team? And then as you go down through DCYF, that's a big, you know, 3,500 employee organization. I mean, are we making some changes there? Reaching out, trying to bring folks up into leadership, advance them in their careers. Is there things like this going on, Ross? Yep. Or excuse me, Mr. Secretary, I'm sorry.
So you call me whatever you want. Just don't call me Sue. Let me gather my thoughts here for a minute. Increasing diversity is an important element. You can choose to do that in a bunch of ways. You can choose to have quotas, which would be, I think, probably not good, and also probably pretty significantly illegal. Mm-hmm. We're pretty committed to, we don't always do this. I mean, I will say we're not 100% committed to this, but when we have leadership jobs open, we want to make sure that we are openly competing them, and that we're pushing people to compete for them. So I want to ask people. I don't always do this. When we promoted Natalie Green to be the assistant secretary, I came to the conclusion that I needed to have someone who was from our existing organization, and that she was the strongest member, since I knew all of them. That was not a job that I had an open competition for. I also needed to do an interim placement right away. But we're trying to do open commitments. We're working very hard to have diverse hiring pools. It's a question I ask when I'm presented with a hiring pool, is how diverse is this hiring pool? We're starting to create the review process for a new chief information officer. That's a position that was held by a white guy. not one that we're going to require to be held by, someone in a particular subcategory to try and balance something, but we will work very hard to have a balanced or at least a diverse hiring pool. The hiring pool of people who live in Olympia is not the world's most diverse hiring pool. So we face that challenge. I wish I could quote you, and I should be able to quote you. I'm actually embarrassed that I don't have these numbers as on the top of my head as I do the kids in foster care. What our racial breakdown overall of the population of employees is. And how did it change through the pandemic? We have about 4,500 employees. I think Marcos might have said 4,800 the other day. It goes up and down a lot. The employee count breathes from day to day, which I find kind of disturbing. We have a turnover problem in child welfare and in juvenile rehab. The whole world is short-staffed, and particularly for lesser paid jobs, the pretty significant pay increase for a 10% pay increase this summer, maybe 13 with the cost of living increase for our JR staff is really important. You could make more money working in fast food prior to that. And I would urge all of you to push for significant increases in low wage workers. You'll see that consistently in our asks. That will help hold on to staff there. Because of the legal environment, it's challenging to sort of push that. We can push diversity in hiring. We can push diversity in making sure that people have valid pools, and we can try and create an environment where people of color feel comfortable working for us. There's a long-winded answer for a guy who didn't have the numbers on the tip of his tongue. I apologize.
Well, thank you,
I'll
Ralph.
get
I
them for you.
appreciate it.
We'll get
I
you
appreciate
whatever we
that.
have on the overall staff makeup.
Okay, yeah, very good. And we can talk more when I see. I got another question, but we'll go to Representative Kagi right now.
Thank you. And thank you, Ross. One of the reasons the department was formed was to assure that high quality early learning resources were provided to our most vulnerable kids, the kids involved in child welfare. And we both know that disproportionality is not only an issue of child welfare, it's also an issue in early learning in terms of outcomes for kids. So my question is whether the department has been successful in really connecting high quality early learning opportunities to children of color in child welfare, so that we can really give them the best opportunity for a good start.
In the last 2 years, we have had a significant decline in the number of children served in Working Connections childcare because pandemic, right? Like all of a sudden, a lot of low wage workers were out of work and didn't want to have their children in childcare, or the childcare wasn't staffed. I mean, you've seen the problems that we've had. What we're beginning to see an uptick in Working Connections childcare participation, which I'm excited about. That would be the best proxy for children served. If low-income children served would be who is being served through Working Connections. And we can get you those numbers. I was pleased that we still have an industry. I would be even more pleased if we return to the capacity, the number of kids in the system that we had prior to the pandemic. And I don't believe we're there yet. Do I have someone on the call who I can?
So the
draw a
question
lifeline
really
to?
is more, what if caseworkers have as a priority referring kids to high quality care, getting kids into high quality care, even though it takes extra steps and
way more
really
specific question.
supporting kids in childcare?
Thank you for the right question. Sorry, I did not understand the question. We are doing an experiment where we have early learning coordinators in some of our offices that actually work to do this. And we're finding that that is, in fact, successful at gaining that. We can have the numerical presentation come to you about the effectiveness of that. I remember seeing it and saying, oh, that worked. I'm sort of frustrated about it because the strategy that you do, which is to put someone in an office who knows the child care space in that community and who acts as a consultant to all of the caseworkers who are trying to convince the caseworker that having high quality childcare is important to the child and to the family, and it provides us another set of eyes on a kid potentially in an unsafe situation, has been challenging. If we do that strategy, we have 80 offices statewide. Do I have 80 people doing this? Wow, can I figure out a way to, I'm not enthused about the scalability of this model, but it does work to get people connected to that service. We will get you that, the analysis of that work. OIAA is doing an experiment in that space. So it works. We're excited about it. I'm a little nervous about, can I scale this? Is it the right thing to scale? How many coordinators do I have in each office? Do I eventually have more coordinators than I have caseworkers? So you can see I worry.
Did that answer your question, Ruth?
Yep. I'm sorry. Is there someone on this call, like Day or somebody who's taking notes about all the commitments I'm making? Would you do that? I can see your face. There must be somebody else on this call from government affairs who's also taking notes, but I can't see them. So I just want to make sure someone takes notes about what I'm promising to give you.
I'm also taking a long list of your commitments, Ross, so we'll get those to you.
Yeah, I know, but you're going to embellish them with all kinds of stuff I didn't promise. I want my.
Well, we're going to do the best we can, Ross, for you. Don't worry. We'll load you up. Representative Kager, are you good?
Yeah.
I'll get you the number. Is the answer.
Thank you. Thank you. Dr. Levy?
Yes, hi. I'm a developmental behavioral pediatrician, and in my job, I see numerous children who, as you said, were languishing, but I don't like that word, on foster care, because they're in really good quality foster homes and foster care parents are taking excellent care of them. Mm-hmm. I've seen a lot of children come out of busted, reunified homes who have very significant issues with their behaviors and development. And I guess when I hear you comment about the importance of getting the numbers down in foster care and the numbers up in reunified, I think that's lovely in theory, but I think we don't spend enough time thinking about the safely part of the equation. And I just guess this is more of a comment than a question, but I just get really concerned if we're looking at numbers too quickly and not being concerned with the safety.
You should be concerned. So when when I talk about safely reducing, when I first took this job, I talked about reducing. And I got all this blowback from people. And I was like, oh, what's the deal here? Well, the deal is it'd be really easy to reduce the number of children in foster care by just ignoring intake calls and sending children home. Like that would work if all you cared about was reducing the number of children in care. But that turns out not all we care about. And so this is a system measure. And we need to have balancing measures to ensure that we're doing that safely. So the balance for the reduction in the number of children in care is the rate of reentry into the system. So if we can say we could increase the reunification rate, but a lot of children re-entered the system within 6 months, we were probably making bad decisions. If we can reduce or increase the reunification rate and keep the reentry rate constant, right? Then we're Pareto optimal on that, right? We're improving the system without damaging anything. And this is why everything here is gray and not black and white. if it was black and white, I'd be selling widgets and I'd have an easy job, you know, like running the prison system or something. This is hard because you have to balance that. You have to ask those questions both at the same time. So I agree with you on the need for a balancing measure. I do want to say, I think there's a philosophical argument that we can all have about the value of family and the value of culture and the long-term positive effects on children of being with family members and being part of something that they know they are part of is really a big deal. Sometimes there are families that just should not have children. It's terrifyingly dangerous. There's sexual abuse. There's people who do medical abuse, which is what they call Munchausen's today. Absolutely, we need to ensure safety. I hear you, and I say that the way we address that is with balancing measures.
So my just would comment back to you is when you present that data, I think you should present the balancing measures at the same time.
I will try and do that. The balancing measures unfortunately lag a little bit because they're measured at a different time in the cycle. But yes, we can do that.
Thank you, Ross. So I have a question. So appreciate the comments on family. Family is everything in my eyes. I mean, if we had a better family structure, I think a lot of what's happening in our culture, in our country, is simply due because our family will break down the family, and that's not a good thing. I'd like to see that reversed. So I appreciate those comments. But I'm very intrigued by your length of stay numbers that you gave us. The average in the state 600 days, but the King County was around 900 days.
800.
So
800, I think.
Roughly. Yeah, I know they were rough numbers, and I'm not trying to hold you to it. But my concern that what I heard you say, and I may be off base, but and if I am, please tell me. But you also said a little later in King County, you had the highest. It's over 60% of kinship care. Okay, so does the kinship care count on the 900 days, or is when you go into kinship care, then they're basically out of that count?
No, they're not out of that count, and that could be part of it, right? We'll tear that number apart as we start really trying to dive into length of stay. We have new legislation from the legislature in its infinite wisdom. I always try and add that disclaimer. Is pushing us to move to guardianships in some cases, which would address if there are aspects of that number that come from having large numbers of children in kinship placements where they're with grandma, they're going to be with grandma, it's stable. We should make that work out. That would resolve that. I have I think at least one other county that's at 60% that doesn't have a 800+ day length of stay. So I'm guessing that's not it, but I do not know that. And that is a reasonable question for us to ask, for you to ask, and we will try and pull that apart. I only have a couple more minutes, Representative Dent.
Okay.
Thank you.
Do you have any other questions from the board?
If there are more, if you send them to me in writing, I'll try and answer them to everybody.
Thank you. And I have a couple more, but they're not very important. They're real important. I'll ask you when I see you here next month. So
happy to do that.
Yeah,
okay.
So
thank you all.
Well, thank you for coming and your candidacy.
Almost always my pleasure. Again, it's a great decision.
Well, today it must have
everything's
been
almost in my life. Thank you.
Good to see you. Looking forward to it. So this is a time now for possibly we could discuss anything that we've heard there from the secretary and around his presentation, or actually open it up to anything that that the board members may have to talk about or discuss or concerns. So please throw it out there. Well, don't everybody talk at once, because it's, the noise is deafening here. Or I'm saying, Ruth has her hand up. Ruth.
Thank you. Well, I think obviously what JRA, the initiatives they're implementing and undertaking are extremely promising and hopeful. But and it's early days, but I don't see any data on the changes in recidivism or the impact on disproportionality, or there was data on the increase in high school graduation, which was very hopeful. But I just I know Krista will be assembling that data, whatever is available for our report. But it feels like we need to see the data, and we need to see more of it.
But I agree with that. I do. And, I had more questions, around that as well, that I really do want to talk to Felice and get into this a little more in depth. Maybe you'd like to be part of that conversation, and I would like that. But there's just some more things that I don't understand that I'd like to know, and where we're going, and what, what we see as the outcome. But the question that I didn't ask, and I was kicking myself there after the break, was how many of these kids that are in the juvenile justice system have been foster kids? And that concerns me, because I remember my very first year in the legislature, and I heard from the Spokane County deputy that was one of those receptions that they have all the time. We have when we're in session, and we're talking about foster kids, and he said that he told me that 60% of the children or of the inmates in the county system had been foster kids. 60%, which I thought was exceptionally high. And the last time I've talked to people that had knowledge of that, it hasn't changed much. So that's so when I think about what I hear, around this, what I know about my own experiences as a foster parent and as an adoptive parent, I mean, I struggle with that. And so where is the fix? And what I heard Ross just say a few minutes ago was how important the family structure, how important it is to know that you belong to something. And so how much of that is a breakdown in the family that is creating some issues? And I mean, people lashing out, kids lashing out, et cetera. So, those are things that I think about that I'm not sure we have. Maybe somebody has an answer for me, but just throwing that out there.
Felice Upton actually mentioned that 79% of the youth in juvenile in JRA are foster kids.
79%.
79%.
Wow.
So presumably, if I know that COVID disrupted everything, but if we look back 3 or 4 years at what the percentage of foster youth was previously, I mean, one of the major goals of the new department was to stop the progression of youth through foster care into our juvenile justice system. And are we realizing that vision?
That's a good question. Dr. Levy?
I'm going to, sorry,
Go
Doctor,
ahead.
just jump in real quick. Dr. Yabar did just email us that the 79% is not the actual percentage. I know that was presented in a slide earlier, and she's presented some additional materials I'll get to the board to clarify that percentage of the cross-system youth. Just wanted to make that statement.
Thanks. I think, the way I've been seeing our role here on the oversight board is to look at the data. And so when we have a presentation like today, which is wonderful, right? We see all these great programs that sound wonderful, but it's really only half the picture. We do have to capture and look at the data. And I think in our role as oversight, just like I was harping on the balancing measures of, not just looking at the numbers of kids in foster care, we have to see those balancing measures to assure that we're doing our job safe, we're ensuring these children's safety. So I feel like, I almost feel like we should ask with every presentation that is, that they present us with what data they have, what outcomes data they have, and because I think that fits with our role. And if they have preliminary, it sounded like they did have a little bit of preliminary, and they said to look at the JR report. Well, I just sort of scanned through it while we were on the meeting, and I didn't see anything that was like clear-cut data. It was a lot of anecdotal stuff that was popping out at me. So I don't know. I'm sure that it's probably in there, and I didn't have enough of a chance to read through it. But I just think that should be something we should ask people to focus on for our presentations. I don't know how you all feel about that.
No, thank you, Diane, for your comments. I appreciate that. Any members of the board? More discussion, questions, concerns? So I'm very well aware that we have some folks in the meeting that are not members of the boards that have their hands up to possibly ask a question or make a comment. But this is why we have the public comment period, and this is basically a board meeting. And when we're in the meeting, we keep it stays within the board. So that's why we have the public comment period. You're welcome to get on the schedule next time, or you can send us written comments or reach out to Krista or any one of us for a possible, if you want to have questions one-on-one. Most of us, I'm sure, would be willing to do so. So it's just something we just don't open it up to the whole world, because then we could be here till midnight sometimes, and that's not the purpose. So, but thank you for your passion, interest, and willingness to participate in our process. So we have 6 minutes. I was hoping we get all the way to 1:30, with questions. And so last week, or not, I guess it was 2 weeks ago, at the meeting we had, I was, I was here for the beginning of the meeting, and then I had something else I had to do legislative wise, and then I was at the end. And I thought the conversation at the end about, some of the issues that we're faced with and how do we deal with them, we look at our legislative authority, and that means a lot to me, that we do what we said, what we put into a statute. I think that's what gives us credibility, and we keep with that. But I've also, Senator Warnick and I, she lives in the same town as I do. We live just not too far apart. We sit down and we talk about every topic, on a regular basis. But there were some current concerns brought up at the last meeting at the end, and I thought it had they were very valid concerns. So I've been kind of talking with Krista, and we've been working with or Krista has been talking to our Kristen Lamson from the Attorney General's office, who basically serves as our counsel here. So to see what we can do and possibly address some of these issues, because I know some people have some valid concerns, and I get that. I really do. I mean, I have concerns sometimes too, but the one thing I worked when we did 1661 with this former state representative Ruth Kagi, and we negotiated this bill a lot and had some deep conversations about what we wanted it to be, and I haven't forgot that. And I didn't get everything I wanted, but neither did she, I'm pretty sure. So, but I think because of that, I really am motivated to stay on track with what statute says, and because I think that's what we have here. And if we go off somewhere else, then we'll destroy our credibility. And I think this board has a lot of credibility and is doing a fine job, and with a lot of passion. And I think it's really important, and we really are trying to make a difference in the lives of our children, both, in childcare, early learning, juvenile justice, and my passion is our foster kids. So Anyway, that's where I come from. And does anybody else have anything they want to say before we adjourn the meeting? No? Okay, well, thank you all. I appreciate you. I really do appreciate your passion for our children and what you do. And please know that if you think I'm off base, jump right out there and say so. You know, I can handle that. I can take it. My ego's intact. So I know I'm looking forward to the next time, our next meeting. So have a good rest of your day. Thank you very much.
Bye, everyone.